9 o'clock. Do we have a quorum? Yes, we do. Okay. Next item is public comment. Do we have any public comment? Okay, next item, approval of the minutes. As the committee read the minutes, do I have a motion to approve the minutes? From last meeting. Do I have a second? Sure. Any discussion? All in favor, aye? Aye. All opposed? Okay, Mr. Walker.
Well, good morning, Governing Board. David Walker, CEO. Our employee of the month is Chris Doucette. Chris, come on up. Let me read what his nomination form says. Chris Doucette is a full-time EMT with Franklin County EMS. He has been an employee since 2011, now 13 years this month. He was nominated by a fellow staff member who noted that Chris is always positive and personable, greeting everyone with a smile, and goes out of his way to help. He has never shown a different side in all the years he's worked at Weems. He is consistent, calm, patient, good with all staff and patients. He is a great employee, and we're so thankful to have him as part of our Weems EMS team. And one of the things I noticed about Chris, he walks in with a very good attitude. Of course, you walk him out of the CO office, you got to have a decent attitude. But you know, he goes about his job, you know, always willing to work, you know, within different departments, just with a good attitude. But he does a great job as an EMT with our EMS department. So, Chris, we greatly appreciate you. You've been here 13 years. You know, that's a testament, you know, to your faith in the organization. So, thank you. Greatly appreciate you.
I just like to add that, and everybody knows how I feel about EMS. We got a big county. We got people spread out. People taking the activities lend to accidents around the water. I guess, Chris, you've about seen everything, haven't you? Stingray bites to goodness gracious, no telling what. I'm sure. Well, this committee and the county appreciate somebody with 13 years. That's invaluable to us. And so, thank you very much. Any other board members? Okay, next item.
The next item we have is, I want to just tell the board about National Hospital Week coming up May 13th through 17th. And so we have a lot of different things that during that week we'll be just sharing with our staff how much we appreciate with them. On Monday, May 13th, we have a staff breakfast. On Tuesday, we have Taco Tuesday, potluck for the staff. On Wednesday, our very own Sheriff A.J. Smith is providing lunch for the staff here. Thursday, Bluebell ice cream. You know, we'll have some Bluebell ice cream here. We're going to fatten the staff up a little bit. And then on Friday, we're going to have a Southern meal. And, you know, I haven't had a good Southern meal in a while, but we have some good old fried chicken for the staff on Friday. And we also we will have a lot of different giveaways, as well as we're going to give a jacket giveaway to our staff with our 65th logo. So,
Great.
A lot of different activities. I send the board out a list of different activities. If you all want to come and hang out with the staff.
You sent us an email on that?
Yeah, I send you an email if you want to come hang out with
So
the
we're
staff.
having National Hospital Week, awareness of health and stuff like that.
Yeah.
And it sounds like the food might not be the, you know, I don't hear no spinach and greens.
No, we're gonna eat healthy next week, and then the following week we're gonna go bananas.
Sounds good to me, man.
All right, thank you all.
Thank you, David. Okay, next item, medical staff report, Dr. Conrad.
Put up? There we go. Nothing new going on the ER side. We're cranking along and keeping the doors open. We had a medical staff meeting a couple days ago. Heather's got the names of the radiology people that have privileges with us to read, and we took off the rolls, unfortunately, but grateful for their years here. Dr. Sanala, Dr. Nitzios. I have a new nurse practitioner credentialed at the clinic, and ask me any questions. It's Same plan as always over there. Dr.
Turn-
Sanala and Itzios are not on staff
Turn your mic
anymore.
on, I didn't hear you. I just didn't quite hear. I saw a couple of, I think it was 2 comments on some Facebook posts about the excellent care they received in the emergency room. I know we give everybody excellent care, but I think I saw 2 that were really, really, really positive. So,
We had a couple recently and really appreciated that feedback. Sometimes we get the other kind, and
I know.
we're grateful for those were from local community members, and particularly grateful when our hometown folks think we did a good job.
well, Courtney, are your nurses aware of these positive comments? Do you make them aware? And I guess all the doctors are aware of it and everything. Good.
And what we try to do, because sometimes we get, comments that, that say good things about the receptionists, nurses. So we try to make sure all the department managers get that. But just a quick story, I was visiting the hospital on Sunday, and I went to see a patient here, and she's a local patient, which just came out of rehab, and she was in Panama City, and the hospital in Panama City wanted to send her to a place in Panama City, and I got a call Sunday night, and she wanted to come here. But when I came to see her, I said, how's your care? She said, there's something going on here. Everybody's so nice. She said, I'm getting treated so well from the rehab point of view. So that was very good. And we, like I tell the staff, we don't, you hear you may hear the one negative that may overshadow a lot of the positives and stuff. And so, they are doing a good job here. We greatly appreciate, our medical team and our nurses as well, as receptionists, because that's where it starts at. Go ahead, Heather.
Okay, so the medical staff made a recommendation for approval. Amanda Page, she's the new nurse practitioner at the clinics, and that would be for courtesy privileges. There's a list of requests for the Vesta teleradiologist, and you will see that on your medical staff minutes. I can read through them. Some of the names aren't easy. Dr. Abdallah, Dr. Antini, Dr. Bu Asali, Dr. Brunson, Dr. Gellermini, Dr. Gutnick, Dr. Kumar, Dr. Malik, Dr. Pol, Dr. Prusan, Dr. Sangji, and Dr. Salenki. And so we're asking for board approval to grant them consulting privileges.
I guess all these have been vetted.
They have.
They went
Yes,
through a
sir.
vetting process.
Yes, sir.
Okay. Asking for a motion to approve privileges. This is a radiology, new radiology group here.
As well as Amanda Page at the
Okay.
clinics.
Do I have a motion? Motion. Do I have a second? Any discussion? All in favor, say aye.
Aye.
All opposed?
Before I sit down, I'd like to introduce Melanie Shiver.
Melanie.
She's our new medical staff coordinator. Kind of taking over a lot of duties that Jenny.
Yeah. And she'll be working with Heather very closely. Melanie, comes to us from Dr. Sanala's office. She has many, many years of experience. So we so greatly to have her here working with us. So,
Glad to be here.
so she's going to be having all of us now.
You got to speak for 5 minutes. Thank you. I'll be the first one to say we picked up some excellent staff at Dr. Sanala's office, and I think that's a good thing. I think it's benefited us and the folks.
Yeah.
So, it's been and I hate it Dr. Sanala closed, but it's been a benefit to our operation from the folks already trained and well-versed and good hard work.
Yeah, especially in our clinics, because we've been advertising those positions for a long time. So there were empty positions, and to have people that went through an interview process, of course, with Susie, but they very well trained. So they just, this is the first time we've been fully staffed in years at the clinic.
David, I think we hired, 5 people, 5 or 6 folks?
No, just 5. Yeah.
5 folks.
Yeah.
Well, that's good. Good for the county. Good for the folks. Okay, clinical services report. Ms. Alford. Who just got back from Paris. I'll have you.
Good morning. All right, just a few updates for the board. We do have 2 new hires since the last board meeting. We have one traveler that used to be with us on night shift. She came to PRN day shift. She's actually here today. Her name's Kelsey. So you'll see her when you walk out, exit today. So she's PRN, but going to work a couple days a week with us. And then we have a full-time night shift RN. So very, very thankful for that. That's a hard position to fill. Somebody that was working with hospice and decided she wanted to work in the hospital setting instead.
For those who don't fully understand what that means, there are things that RNs can do that LPNs, however great they are and we love them,
Can't do.
can't do. And so this gives us the additional ability to admit more people at night.
Yes.
Very
Good.
important.
Yes,
Good.
very thankful for, all nurses and especially RNs and especially people that wish to work full-time nights. It's a hard position to fill, the hardest position in nursing, so very thankful for her. So she actually oriented for her first night last night, but she has about 5 years experience. She did 2 travel positions and was in the ICU for one of them and was a respiratory therapist for a little bit before that. So she comes to us with good knowledge. So very thankful. And for Kelsey as well. Kelsey is here today, and Erica is the night shift nurse. She was here last night. She'll be back tonight. So very thankful for that.
Courtney, with the efforts over the last 2 or 3 years, I believe, with getting the salaries up to par, and also some of the benefits that we have, is that starting to help a lot?
Yes, it definitely helps. Yes, sir. It's definitely helped, and we hope to continue to move on that as we can.
Oh, I know.
But
Yeah,
it's
we
been a
got
great
to.
benefit.
We got to. Yeah.
Yes, it's definitely helped. So we're thankful. I wanted to say that Dan Paulson, our swing bed care coordinator, is continuing to work hard, get out into the community. He was at Gulf Coast College this week, 2 days, at a health fair. We got about 5 resumes of new graduates from there. He's continuing to get out in the community. He has stuff scheduled with Franklin County School, the health career services over there. He's going to be there, I think, on the 17th and take some staff members from each department. They're going to do some training, be more active in the school. He also attended the Cops and Kids Day along with Chris, who was there with us as well, and some of Randall's staff. So very thankful for Dan. He's reached out as far as Tallahassee, Bay County, visited Chipley's Hospital. He stopped at Eden Springs, a nursing home in Wakulla, Crawfordville. Said they didn't know we existed, and since then they've been sending their X-rays and CTs to our facility. So we're getting outpatient services. So he's doing a lot of community outreach, and we're thankful for that. So. With Dan as well, and Dr. Conrad's help with the physicians, we kind of made the swing bed process a little bit more routine for everyone. So every Monday we have care plan conferences on all our swing bed patients where the physician, myself, Dan, and therapist, and the family member are part of that. We've always done that, but we've kind of not done it consistently on Mondays. We've done it through the week, so now we're consistently doing it on Mondays for routine for everybody, including the patient. So we're thankful for everybody's cooperation there, and it's working well. Then I want to just tell about a couple trainings we have. On May 8th, we have a lady from FSU who also works with hospice coming in to do some hospice training, because we have the hospice room in 105. So this is going to be the first of many trainings from hospice and the FSU College to come and train our staff on how to treat in a hospice manner, because things are different in a hospice world than they are in an inpatient world. So we're thankful for that. That'll be the first training, and we're going to do them, if not monthly, at least quarterly, and continue those. So, and then we have a BLS, ACLS, and PALS course, which we offer twice a year here. We have that scheduled for May 15th, 16th, and 17th, and that's offered to all our employees, from physicians to the clinics, EMS, and all the staff. So we have 3 full classes scheduled for those days with the same provider that taught our trauma nursing course, which we enjoyed that course, learned a lot. So good things going this month. We have lots of outpatients scheduled. We have we did do 2 blood transfusions last week on outpatients. We have 5 people scheduled for the same injection. It's a Q6-month injection next month, starting in May. We have 2 infusions already scheduled for next week, so we're trying to continue to work on that and getting them in here, getting them taken care of. Any questions?
Any questions, anybody?
Well, while Courtney is up here, and Randall will be up next, I got something on my report, outpatient therapy services, physical therapy services. You know, the physical therapy group in town has closed. It's, but they'll, you know, end of this month, they'll be closing down. And so we did meet with our physical therapy group internally here that we contract with to provide outpatient services. I know that they reached out to coordinate. Bill sent me some information about them as well. And so, you know, we'll look at some numbers and then we'll come back and let the board know. But we may start some outpatient physical therapy services here on the grounds using our own PT rooms. I think that'll be good to fill that need with that.
Yeah, I think so too. I actually had a voicemail on Monday from a lady
Good.
that was trying to see if we had that service. And so when I talked to her, and I talked to her again yesterday, she's having to drive from Carabel to Port St. Joe. And she's not real
I know
pleased.
2 people that would have loved to have had that.
Yeah,
I
so
mean,
we're
really.
hoping, we're
Yeah.
working with the therapy group, who
Yeah.
we like their services they provide here. So I think it'll be a positive thing.
I got a question. It'll be part of the hospital, will it take CHP insurance?
Oh, yeah.
Okay,
Yeah.
that's
Oh, yeah.
a big question there.
Yeah, well, that's why most didn't survive, you know, because CHP is a big provider. They, like the Tallahassee group, you know, CHP would not contract with them, so that's why.
That would be an excellent service, so they come here to the hospital, get their physical
Yes,
therapy.
sir. And just come.
Wow, that'd be a big lick right there.
Yes, it would be.
Yeah. And then also on my agenda, for my report, but it involves Randall and Courtney, on section E, the University of South Florida Center for Advanced Medical Learning and Simulation is one of the world's largest freestanding simulation facilities exclusively dedicated to training healthcare professionals. They have reached out to us. We were like 1 or 2 hospitals that they reached out to through our partnership with the American Hospital Association. And so they want to partner with us to do some simulation medical training here. And so we'll probably want to be one of the first in the state, small hospitals in this area that they're partnering with. So that's going to be really good for us. And I think that's going to really open the door to other relationships with the University of South Florida Medical Center there. So I just want to, you know, share that because they're involved in that.
Are you still going to report on that?
Yes, yeah. I'm gonna report on it as soon as we told them one of our top 2 exercises that we wanted, you know, and so once we, you know, start moving towards it, you know, we'll come back and give the board an update with it as well. And I'm sure, you know, before they move with it, I'm sure they'll do some press releases and all of that. But they call it now the Center for Advanced Medical Learning and Simulation Without Walls, meaning that they want to go out into the communities, especially rural areas, things like that.
Wonderful.
Yeah. Okay. I just wanted to share that while y'all was up there.
Okay.
Great.
You
Great
want to do,
report.
which one would you like to go first?
Oh, yeah. Let me do Susie because she's not here, and then Brenda, you can come up. Susie is not here, but she did want me to give you a copy of the all the services that the clinic is operating with. I did meet with Commissioner Jessica Ward yesterday. You know, we took a tour of the Apalachicola Clinic, and I gave an overview of the different services we provide. But 2 things I want to highlight for the clinics. Since the beginning of this fiscal year to the end of March 30th, they did 682 walk-ins, and then they have 383 new patients. And then I think from last month, I think we picked up maybe 100 new patients in the clinic. And so we're seeing the clinic is really growing. Also, on my report that impacts the clinic physician recruitment, you know, we will conduct an introductory call with a prospective primary care physician candidate this afternoon at 2 o'clock. Individual reached out to us. You know, we're advertising on this website called 3RNet for rural health professionals that want to work in rural communities. And so we have an introductory call into her this afternoon, and I think Robin also sent some emails out to 2 other physicians that have interested in coming into the area. So I will update the board as we move on that. So that's good news for that.
Wonderful.
And Duffy, this is what you asked for
Yeah.
Yeah.
a couple meetings back. So now you know what services we have here, so you don't miss anything.
Well, that's not the hospital, though. That's just the clinics right there. You know?
Yeah.
I know. I'm learning as I go. Thank you. You had the solution.
But we do have that coming too.
Yeah, that's coming next.
Yeah. She's working on that.
Okay. All right, EMS.
Good morning, board.
Good morning.
How are we doing today?
Good.
All right. Just for our total call volumes for March and April, we were at 292 calls, with 197 of those being transported. That means our transport rate is 67.5, which is about a 3.5% increase over the last month and a half. As I told you guys, I gave my captains a goal of 5%, and we're halfway there. So that's an improvement there. We have one paramedic that's coming off orientation. That's a part-time. Unfortunately, we have one full-time medic that will be leaving us. She's moving to Maine to be with family. So nothing that we've done, nothing we can control in that aspect. And we got two paramedics in limbo that are part-time. We're just kind of waiting on them. For community outreach, as Mr. Walker and Courtney had said, we had Cops and Kids on 412. That was a success. Good event. We also were able to get in touch with Survival Flight and have them come down, so they were able to make it down for that event as well. They appreciated that. We have CPR research classes for SGI, or St. George Island, and Appalach Fire Department that we're going to be doing here soon, and as well as St. James Golf Course has reached out to me to do a CPR class for their employees as well. So that's good. For upcoming events, we've got of course, the health fair day. We'll have a truck out, and we'll be doing heart rate, SpO2, blood pressure, and blood sugar checks for that day. And of course, the ambulance will be there for the kids and people to look at. And then, not to take away from Hospital Week, but we kind of get a double dip as EMS Week follows Hospital Week, that week of the 20th to the 24th. I've been reaching out to local community businesses and getting donations to hand out to the crews. I've got a list of them. I don't want to bring that up just yet, just because I want to kind of be a surprise to my crews of what they, I'm going to raffle off different things for them. We also have some local restaurants that are going to cater for the day as well. So whether I go pick it up and bring it to my crews, or they go to the restaurant for that day, and the meal will be provided by. So that's all good stuff there.
Would you, something like that, would you make sure you get it on Facebook or something like that?
Yes, sir. Mr. Walker's given me permission to put their business cards up on our webpage for the hospital, and we're going to put it on on our EMS Facebook.
People like seeing that.
Yes, sir. So it's real good response. I haven't, knock on wood, I haven't had anybody turn me down yet. So that's really good.
Right.
I like the community involvement and getting them involved as well. So it helps out. I think that's about all I have. Any questions for me, guys? Yes, sir.
Coming over here, the last 3-4 times, Alligator Point.
I can't hear you. Yeah, get a little closer to the mic there.
Well, let's see, it was on there.
I don't hear very well.
Okay. I'm going to get you a hearing.
My wife says I need to hear.
He got his eyes fixed. He's going for a hearing aid.
Yeah, I'm not your wife, so, okay. Bottom line is, coming over here, I have gone past, I guess, an EMS. Is that a staging area where I see 3 and 4 EMS trucks when I come over here?
No, sir, and I'm glad you brought that up. I just had an email from Aaron, the finance at the county. That is one of our stations in that complex there, just like the East Point station is in the shopping center here. That is one of our crew stations. But since you brought that up, I just sent an email back to Aaron involved in the station in Lanark. Hopefully we'll be breaking ground soon on that. I don't have a date for that yet, but we are in the final stages of plans and getting everything situated for that station.
Have you thought about bringing up with the county to take and do some repairs on that old firehouse that they had down at Alligator Point and use that for a staging area also? I mean, you've got two or three bays there. You've got upstairs where someone used to live, and they could probably spend $5,000 or $10,000 on just upgrading it for the short-term period. Then you'd have another station.
Stations would be great. Unfortunately, staffing would be the issue on that one. we're having trouble recruiting now. I would love to have that, option. To my knowledge, knowing working with the fire department over there, that station is in desperate need of a lot of work. It would be a lot more than 5 or 10 grand, and a new roof, and then all the water damage from, rain and stuff like that.
Well,
That's
it's
happening.
going downhill, I think.
Yes, sir.
Do you have a histogram or anything like that that shows the approximate time of days that you're having to make runs to Alligator Point?
No, sir, I don't. I can bring that next meeting. I know that we average about 40, maybe 40 calls a year to Alligator Point. So it's not that big of a number. Granted, sometimes it's 2 or 3 in one day, but I could bring that number back to you.
Along with its breakdown as to what type of calls they are?
Yes, sir, I can do that. Yeah.
Thank you.
I can get that for you
Thank you.
next meeting if you don't mind.
Thank you.
Any other questions?
Equipment,
Yes, sir.
are we still fine with equipment and
As of right
everything?
now, yes, sir.
Absolutely, everything that we need on those ambulances.
Yes, sir, and we just, Ms. Heather sent me a grant over the other day, and we sent it to the county. Was it signed?
It will be at the next county.
Okay, next county commission, it'll be signed. We're actually gonna put ultrasounds on one of our units. So it'll be a portable ultrasound that will be able to do a fast exam.
really?
Yes, sir. Fast exams for trauma alerts, assist with IVs, and it also, be a diagnostic tool for pneumothorax, so that when we decompress somebody, we're actually making sure that we have another check in line.
Wow.
But, and
Wow.
I'm glad you kind of brought that up, because I kind of forgot about that.
Wow.
So that's, my goal is to eventually have one on every rescue, but now we're just gonna put it on the captain's truck. That way that the supervisor will be there, also to have a second set of hands as well. So that's good stuff. And then for your poor vascular access patients, if ER needs somebody, ER or the trucks have a hard time getting IV, we can come in and get a little deeper vein with the ultrasound.
You said your goal is to get that on every truck.
Yes, sir, I would like it on every truck.
Well, is there a reason why we would wait?
Well, funding.
How much?
They're about $3,000 a piece, and then, so that would, not terribly, but if we can just, through attrition and then getting training, make sure all the staff is up to par on using them.
Are they necessary life-saving systems?
Potentially, yes, sir.
Potentially?
Yes, sir, especially when you come to someone with a pneumothorax or collapsed lung, that'll give you a tool to show that, they actually need a needle in their chest. And
My question is, what are we waiting for?
What we can do,
I'm just
Yeah,
saying,
no.
I want us, I'd hate for something to happen to me or a friend and we get the wrong ambulance, didn't have on it that would assist, I mean, I'm all for equipping these ambulances,
okay,
100%.
Yeah, what we can do then, technically, we can get some quotes, for all the ambulances, for that. And then we can make a plan, to present to the hospital board, present to the county, to purchase them. But we also want to make sure the staff get trained on using them.
For
Yeah,
sure.
well,
And another reason, so the ultrasound's not a state requirement. So that kind of makes it a little more like, this is actually just
Right.
advancing our services essentially. So it's not actually a mandated or a needed item
I
on
understand.
the advanced life support ambulance. So it's one of those ones that's kind of do you have to have it? No, you don't have to have it, but it's just something that we can provide.
Have they got them in Tallahassee?
No, sir.
Well, where do they have them,
Actually, there's not many services that do have them. It's kind of new to the area.
Would the board agree that we want to pursue this? Just,
Yeah, we should get a number and see what that looks like.
yeah, I'd like to do that.
I'd love to have them on every unit. I just was trying to do it, through the best means possible without coming to you guys for money right
The
away.
best way, life safety, is to get it done. That's
Well,
it.
hey,
Don't be afraid to ask.
I ain't gonna
What I'm
argue
saying.
with you.
Okay, good.
Not gonna argue with you on that.
Good.
So, yeah.
Yeah. So we'll get some quotes on that, and then Brandon will come back, at the next meeting, present those quotes to you all.
Sure.
Yeah, let's work on that. Great.
And these are, they're called a butterfly, so if you wanna look up online, it's a butterfly ultrasound, and they hook into our iPhones or better yet, we have tablets that we can hook them into, which we have a couple, so we may have to add that into that quote as
I
well.
realize it'd be training and stuff like that.
So it would definitely benefit. Would we use them a lot? I wouldn't say we'd use them a lot, but it would be times that they would need to be used.
2 times a year might be very important to somebody. Okay.
Any other questions?
Yeah, I don't know if it's a fair question or not for you at this time. I don't know if you looked at the financials, but it looks to me like the revenues, ambulance service revenues are down significantly. Or is that from unpaid, or is that from just not as many trips, or?
Yeah,
what?
so, let me speak on that a little bit here real quick.
Yeah, I didn't know it was fair to ask now or to wait to ask that question.
Right, yeah, so they are, it's a combination. You're looking at, on the financial statements, those are gross revenues, not the actual what we get paid. The contractual would have to come out of that. But the revenues are down. Revenues are down about 32.5% over year. But the billable runs are down about 12.5%. So we're actually currently looking at, everything from the level coding to the miles that we've been running to try to figure out why they are actually down. Because we I know we've had less runs, but,
Yeah.
the other question is are the average number of miles on a billable run, are they down also? Did last year we have a lot of, maybe we had to go all the way to Jacksonville several times, and we haven't this year. So we're looking into those types of details to figure out exactly the reason why.
Yeah, because I mean, you're
so,
looking
yeah.
here at the financial statements about $334,000 year to date.
Oh, absolutely.
Off the numbers.
Correct.
And to add to that, that's another reason I give you the total calls that we've had versus transports and the percentages. The percentages of those calls that we transport are calls that we actually are able to bill for. Now, not all of those are going to be insured patients, so some of them will be self-paid, and that's going to hit us harder. So, yeah, that's one of the things to get that transport rate up. That gives us an opportunity to bill more and increase them numbers, potentially.
Right. No, thank you.
Okay, thank you. Thank you.
And next time, Mr. Berry and Harrison, I'd like the memo to get garnered. I look pretty good in that issue as well. And we don't want to hear anything from the Gator fan at the end.
Oh.
I said, next time y'all wear the garnet, let me know, and I'll be in garnet too.
Everybody comments on that shirt.
No wonder he's on his water like that.
Okay, hello, good morning, everybody.
Good morning.
I'm going to give you my first HR report since I started about 2.5 months ago in February. Excited to
Well,
share.
let me introduce you.
Oh, y'all know me. Okay, I'm Robin Paulson.
Robin Paulson.
Yes.
You need the HR assistant.
HR assistant.
Thank you.
And still executive
Thank you very
assistant
much.
as well. Okay, so we have hired 9 full-time staff, and as was previously mentioned, 5 of those are from Dr. Sanala's office. Clinic registration, a certified nurse's assistant, certified medical assistant, a phlebotomist, and then Melanie, our medical staff coordinator. We've also hired a new full-time EMT person, a new paramedic, 1 new full-time general maintenance worker, and the full-time night shift RN. So pretty excited about getting all those in the last 2.5 months. Along with those, we've also hired 5 new PRN staff, which we've hired the nurse practitioner that you just approved, Amanda Page, for the clinics, 1 paramedic, 2 RNs, and a registration clerk that is doing PRN covering the ER and outpatient in the front. We also hired 1 traveler, which is a medical lab technologist. We're still, working hard to get candidates in for that so we can hire someone here as a staff member. But in the meantime, we do have someone helping us in that role. And then in the past 2.5 months, we've had 2 full-time exits, which were Louie and Jenny. And then we've had 4 PRN staff that have left. 1 was in registration, 1 general maintenance, an RN, and an APRN that were all PRN employees as needed. Also, Mr. Walker mentioned about 3RNet, which is a platform that we use. It's a free platform that is free to rural hospitals to try to help with staffing assistance. And I got access to that just in the last few weeks, and I'm really excited to share that we've had some really good feedback from that. I'm checking it. We get referrals every week from that. I'm working that, responding back to them immediately, sharing the information with Mr. Walker, and like he said, we do have an interview this afternoon, and we have 2 other candidates that have sent their resumes, and actually 11 responded this week, and out of those 11, we're working to get interviews with Mr. Walker for 2 of those, so we're really excited about that progress. I've also gone through all the staff employee files and made them ADA compliant, and that was quite a project, but that's been done as well. So I'm just continuing to do everything I know to do to keep things rolling in the HR department. You guys have any questions?
I have one.
Okay.
I need some clarification on, did you say that you hired someone in the registration intake full-time
Yes, at the clinics.
at the clinic?
Yes.
Thank
Yes.
I have a question. These positions that you're hiring, are these existing positions that are vacant, or are these positions just what on an as-needed basis?
No,
I'm not quite understanding the authorization process.
you can check on our website to see our job openings, and these were all positions that were needed. Like, for instance, the 5 that we absorbed from Dr. Sonala's office, they've been working without staff for years.
Wow.
And now that we are getting so many of his patients, it came at a perfect time for them to come over.
I still don't.
Yeah, they were.
I still don't comprehend.
Okay.
I'm trying to
Yeah,
understand.
they were.
Are they existing
They
positions
were.
that we paid for before?
Yeah, they
Or
were.
are they new positions?
Okay, they were vacant positions.
Good.
Vacant positions, and we probably have one new one there, here. And like we mentioned about the clinic area there, they've been understaffed, vacant. Susie Busker, you remember she'd been working the front desk, couldn't get a front desk person there. Then she lost a couple of nurses, some move, some leave. Most of our PRN positions that we have, we kind of keep those positions rotating. Those just open positions. When we have like a swing bed coordinator position, we created that position there. But the positions that we hired, most of them are existing vacant positions that we needed to fill. Yeah.
Did you say one of them was new?
Well, the medical staff coordinator, that's not a new position technically. It's just that we just broke that position out. From before, you had HR doing medical staff coordination and a lot of different things. So we just broke that position out, to focus on our medical staff coordination there.
Is there a process by which you get authorization to create new positions, or do you just say we need that and we go find it?
No, the process, if one of the department managers, need a position, they come present that position to me. I am the one that make, with, the authority to create that position if we need it, technically. Yeah. So it's a little different from, I know John looking at the lens of state government, state government per se. You know what I mean? You have a certain process to say, okay, do we need this position? This position is vacant. Do we need to create this position? These are the requisitions we need to do. Our process is not that elaborate, but we do have a process in place here.
Gotcha.
Well, it's just a matter of how you control your costs, and that's what I'm looking at.
Yeah, correct. Yeah.
And therefore, there has to be a process in place. I think I understand it. But you just can't go out and say, I need a new position, and then create it and then hire without somebody saying, hey, how's that affect
we look at, because technically that's why, if you look at our organization, we've been kind of, we've been streamlined pretty much. We don't have a whole lot of positions. We kept positions more vacant, you know, because that enhances your cash. But also, you're not doing your job at an ultimate level, so you have to begin to staff for that. And I like the way, we position right now at the clinics, because, we begin to staff for growth, although we've been limping in a way, providing that services. But now we're providing service more in an efficient manner. But now we see the growth of that too, that is coming, through our clinic services. And Robin has been doing an awesome job, and I always tell people, if I give you your job, don't bring it back to me like I gave it to you. Take it to another level. Think outside the box. But with 3R Net, that's a site that, Robin and I, and that's on my report too, we met with the director of the Member Services Division, and he gave us some tips on that. So now, we're getting applications, coming in that we never got before, too much with. And so these are, people that want to work in rural areas because they have a student loan forgiveness program here. We can offer that as well. And just the number of applications that we got from physicians, just was kind of amazing. So that's some good things that we're doing here with that. And then also she still helped me out as well. But she's doing a good job, getting her feet wet on that. I thank all the staff and appreciate that.
Thank you. Thank you. And we always make sure that everyone has checked everything, and that there is truly a need or a vacancy. So I'm not just like hire people.
But that's not even, that's not only that, because before Robin did that, we have Employee of the Month. You know what I mean? That was something that I wanted to get started here, and she came along and just jumped in to do that. All that good stuff on the board there. She just said, hey, Mr. Walker, can I just redo this bulletin board? Go ahead on. So, these are some things that, she's bringing to the table. So we appreciate her. And plus she got to go back and take the minutes for what she's talking right now.
I have one last question.
Yes.
Congratulations on your position, new position. What kind of experience or background do you have in HR?
Well, I owned my own business for 8 years. And before that, I worked for a food management company for 9.5 years. That was really where I got the bulk of my experience, because I was a regional director.
Mm-hmm.
I traveled throughout the state of Missouri, and I had to go in and not only interview people, I had to set them up, train them, and then I was responsible for, how well they did in that role. We were a food management company that managed school food service. So I did that for 9.5 years before we opened our own restaurant. And so I had those years. Then we moved down here. I worked with Orange County Public Schools in Orlando, Florida as a school secretary, and I managed all the interviewing, working alongside with my principal, and also just the whole hiring process, making sure that all the paperwork was turned in. So it's very similar to what we're doing now.
Right.
We have a vendor that we use, which is Decision HR.
Right.
So, and that was in place when Jenny was here as well.
Right. That's
But-
from the least employee perspective,
Yeah.
and they handle our workers' comp policy, and they are providing HR services as well. So you have support through that organization, right?
Which is great. But I also then left the public schools to work at Universal Studios for 6.5 years. I was an executive assistant where I did a large portion of what I did was onboarding. So I feel like I come with good experience to this position.
Yeah, I hope so, because that position, obviously, in the litigious society that we have today, there's a lot more employees suing employers because of workplace issues.
Right.
So you really have to be careful on what we do and don't do with regard to
Exactly.
employees.
Yes.
I just wanted to put that out there.
Yep.
Yeah. And that's why we have Decision HR. They have a labor team, attorney team as well, that they give us feedback on HR issues.
One last question, two
Yes.
parts. Do we have position descriptions for everybody on the staff? Two, do they have attached to them the KPIs that are necessary to apply for that position?
Yes.
Yes, be yes.
Yes. And
Two
yes.
yeses.
And Deborah, when I left Craig, I missed Craig Gibson on the agenda, saying operations, but I want to bring him up after Robin.
Thank you all.
Go ahead,
I-
Robin.
Thank you.
I want
Thank
to
you,
say
Robin.
something to Robin. Robin, I want to say something to Robin. With all of that experience that you have, which is a wonderful thing and necessary, However, from the time that I met you, when you first became Mr. Walker's
System.
assistant, you have an immense amount of empathy. And not only that, you know how to talk to people so that they receive you well. And with all of that experience, if you don't have those things, then all of those things are sort of new. So I'm so happy that you're in this position.
Thank you. All right, Mr. Gibson.
All right. Good morning, everyone. I'm Craig Gibson, Plant Ops Director. We've got quite a lot going on with the fire system here. We had our quarterly inspection in March, and in that inspection, they do the tamper switches with the water flow devices, the sprinkler systems, which is in the main drain, and the fire department supply connections. During our inspection, we have learned that all of our sprinkler heads have to be replaced. They were on a 50-year replacement plan, but ACA has changed that now, or NFPA has. They're 25. Now it's 20 years. Our sprinkler heads were, the oldest we had was 1999, and then we had 2023 is our last one. So that's 45 years. Unfortunately, since they've changed it the first of the year, we're going to have to replace every one of them. And we're working on that now. They're going to get us a quote, what it's going to cost and everything. We're also working on replacing all the damper controls in the haddock system, which if there is a fire, they will close automatically. They should be finishing up with that. They're here today to finish that up. That's been an ongoing job from, I believe, 2021. Kind of started at the end of Michael is where this came up. And thank goodness I did get a new hire for maintenance. He is well versed in this. He comes from us from Georgia. He has worked at a nursing home, so he's well versed in the maintenance, the floor care, and looking forward to working with him. About 2 more weeks, I'm going to probably turn him loose on a lot of things. I'm just showing him around. He's eager to get started. He went over to the EMS station in Carabel a week or so ago with me, and we replaced their water pump that's up under their sink. We took care of that, and he was eager to get up under that sink and cut it out and put it in. So worked very well for me. So let's see. Okay, getting back to the fire stuff. Fire sprinklers, not sprinklers. I'm sorry, the extinguishers. We did our yearly check on that. We're going to have 9, 10, 11, 12 of them. They're going to do what's called a hydro test. That's where they drain it, they replace the O-ring valves, and then they'll recharge it and test it, and then they'll bring them, the helipad, they'll bring back to us. That one they got to take and do it in shop. The other ones they can do on site. Let's see. Excuse me. The outside metal doors, getting those replaced. Talked to Door Products yesterday. They are expected to be shipped out on May the 10th. They'll arrive 2 to 3 days at his shop, and then he will send me the schedule to get here and get them installed. So that'll be good. Yeah. Dietary department. Our last PRN person, she'll be back next Monday, and we're going to give them about a week to get reorganized and everything, and then we'll start cooking for staff again. Give them a chance to make sure they're all good. Let's see. We're looking at replacing the cameras. We're getting a quote. We have learned there's some issues with, like everything else, China has a back door into these cameras. So we're looking at replacing them all and getting rid of them. Yeah, I know. IT department found.
Yeah, that's going to be very important. And we're looking at putting that one of our grant projects for fiscal year 2020, state fiscal year 2024. So that'll be due pretty soon. So we'll put that in for our capital improvement grants. Also, Craig been involved in preparedness.
Go ahead.
Go ahead. The preparedness.
Oh, yeah. Yes. Yeah. Yesterday we did I don't know, there was like 15 to 20 other hospitals. we did a exercise which is called MRSA, but it's a medical response and resource exercise. And all that basically is more really like a tabletop, but you have other hospitals emailing you, well, we need to provide this, can you provide this, do you have beds, how many, what else was it, Courtney? Infusion pumps, suction pumps, can we provide all this? So Courtney and I did that about half a day yesterday. So, but that gives us credit for exercises. I'm working with Big Bend Healthcare Coalition. They help provide all these exercises for us. And I'm working now on a active shooter tabletop. They haven't given me the date on that yet, but that's coming up. This afternoon, we'll be working with the Department of Health. They are actually doing a COOP exercise, continuity of operations. So they'll be over here, and we're going to walk around the facility. They'll do their questions and everything. So that there's another exercise that gives us credit that we have to do yearly.
Yeah. And one thing is about continuity of COOP, continuity of operations plan, meaning that if the hospital shut down, can we still move somewhere else and provide services? It's almost like when Hurricane Michael came. They shut the building here, but they went to the clinic.
Right.
So they didn't know they were doing a COOP exercise then.
Yeah.
So we're participating with the Department of Health this afternoon. So that's very important.
And they're actually moving their department and going to Gulf County, which is fairly easy for them because they don't have hospital beds that we've got to move and all the other equipment that we would take to go to over here next door.
But once we change something out called voice over IP, and so what that means that, if we have to move off site, technically we don't have to worry about physical phones. You can go anywhere and log back in. So that's what the Department of Health is doing in Gulf County. They'll shut their phone system down here, but they got voice over IP. They can go any place and work. And so,
Yeah.
so it's very important, those kind of exercises.
Yeah, and speaking about that phone system, I've started working with Kevin and MIT. We are putting up some bars up here so we can get the communication back and forth over here to the clinic, and we're starting that process. So we have that equipment on site.
I like you're busy. Anything else, Craig?
Any questions? No? All right. Thank y'all. Y'all have a good day.
Wait.
Oh, one more. Go out like this, use the fire suppression system. When you go out to upgrade those sprinkler heads and so forth, you have it's all, I'm learning, you have a dollar limit as before you have to go out with for a written process to acquire those services. We're under we have a 5-year contract with Johnson Control. Now, I'm not sure about this, to answer your question. I'm not sure that we couldn't go out and find somebody else that might be able to put those sprinkler heads in, but that's something we can look at. Well, I'm just trying to get to, are we doing it most efficient? Are we cost-wise? Right. Yet still have the quality. We don't want shot no. Quality, but it's very important in that situation. Yeah, absolutely. Is there a process to go out and contract services? Or do you select, who selects, and what's the dollar amount that before somebody else has to be involved? Well, I know since we're under contract with them, we use them for all the repair, just like the fire extinguishers. They're all covered in that contract. But now we do put out a contract to see, or put out notice to ask what we want. Who is it? Trying to think of somebody else that's out there in fire
Maybe
sprinkler.
this will help a little bit. You have a limit on that contract with Johnson Control, or do they just charge you a flat fee annually to do all the work, supply the inventory that's necessary? How does that work?
Okay. All they do is they come in, do their inspections, and then if there's anything that needs to be replaced, then we get charged for it if it's not built into that contract. And the sprinkler heads obviously are not built into the contract.
So then is that contract got a limit in some place?
Not that I know of. It's a set fee what they charge us. Yeah. But I'll look into it, and I'll let you know next month.
Well, maybe this would help. So do you have, do we renew that contract on an annual or 5-year basis? What's the renewal?
It's 5 years.
5 years.
Mhm.
So I guess to answer your
Yeah.
question, John, maybe every 5 years, we would put that out to bid
Put it out.
and see if
Yeah.
there's someone else that can do it. If they can't, then we stay with who we're with. That's what you're getting at, is getting bids out there on contracts?
Yeah, I'm trying to get to the point of the upfront, out of his hands, but with multiple eyes on the process.
Mhm.
Follow what I'm saying?
Yeah,
When you
at
go
a
with
certain dollar
selection,
amount.
there has to be a selection process, and you don't want to get looked at in a jaundiced way by outsiders who say, well, you don't have a process in place.
Mhm.
It says, you're just giving your contracts to your good old friend.
Oh, yeah.
Yeah,
Yes,
we're
that's,
bidding them out.
yes, I'm saying,
Okay.
yeah, Justin Controls, and I think they may also do the county's, fire in the county also. But I know that when you look at Johnson Controls, that's just one. I'm sure there are others out there, but they meet the need that we have, that we need to meet for ARCA many times, your ARCA reports, because all of that got to be, make sure that's in line. But there's others out there, I'm sure, that may do the same thing. So we'll look at
Yeah.
that when that contract ends, and then we'll just bring it, put it out there, bring it to the board, you know what I mean? We got 3 that provide the service, as long as they meet the guidelines of ARCA requirements, because that's very key. 'Cause when ARCA comes in and look at who's been reviewing our reports, they look at the company, make sure that company meets all the guidelines in the reporting system.
We use Johnson Controls, you said. They are very reliable.
Yeah, I know.
That's,
Yeah. I was gonna say I know they do the
about
prison
them.
system.
They are very, very, very reliable.
So also, when we get quotes and things like that for any projects that we do, we also run them up through our GPO, our group purchasing organization, to make sure that we have contracted pricing and everything, so that we are getting the biggest bang for our buck, for lack of a better term. But everything, everything that we're doing, we try to stay as contract compliant as possible, because also as part of being contract compliant, there you get rebates and things like that for staying contract compliant as well. So we're going through all those processes. There are processes in place for that, to be a little more specific. So,
Greg, I got a question for you.
Yes,
You know,
sir.
we have storms and hurricanes and stuff. In an emergency purchases, I know it'd have to be authorized. We have that ability. Emergency purchase. To go down to Ace to get something.
Oh,
We
absolutely.
do.
Absolutely. Yes, sir.
Okay, I just want to make sure we need
Yeah.
that now.
Oh,
We
yeah.
absolutely have to have that, up to a certain limit, I'm sure.
Right.
Okay.
Yeah,
What-
we get to a certain limit there, and I really,
Yeah.
I don't know what it
I
is.
know, I
We've never
understand.
got there
I
before,
understand,
so
but
we
it can
use it
happen.
for just,
Should be a
minimal
policy.
stuff.
Yeah,
There is policy.
yeah, when something
Yes.
needs to, purchase something, he can, of course, I sign up on the purchases.
Exactly.
You know, technically, but, emergency, we just need to get it done, then if it's,
Yeah, I always
You
go
need
through
a
David.
credit card you keep locked in a safe and be able to use it during an emergency. That's one thing you need to do right there.
Yeah.
Put it in a safe.
No,
Use it
no,
for
no,
nothing
no.
else.
He don't, it goes to, Heather's not here.
Heather, yeah. I
Yeah,
was
no,
gonna
no,
say,
no, he don't keep
Yeah,
it in the safe.
yeah, I don't
We
have
got
any
it
credit
somewhere
cards.
else.
Y'all just opened up another.
Okay.
Yeah.
No, but that's not there. That's not there. Let me just say, that's not even. That's
I've
not
had to
there.
make emergency
not going
purchases
there.
before. I mean,
You don't
you
want
gotta
that
do
at
it
all.
sometime,
And there's only, anywhere we go, like Wind Supply or the Ace in
Right.
Carabel, if your name's not on that list, you can't charge. And you have to have a PO number in order to be able to charge, and that's on that PO what you can buy. And no more, no less. Yes.
Okay, anything else, Greg?
Just one
Thank
more
you, Craig.
question.
Yes, ma'am.
A month before last, I believe it was, I asked you about the upkeep of the rooms.
Mhm.
You recall that? Have we hired somebody?
I have no resumes or anything for that. I've still got it out there. I actually had some that I went back that had previously put in an application, and I've contacted and left messages, but I have not heard back from them. But with our dietary department getting back, now I'll get my PRN back in. She comes in the afternoons, so that's going to help us make sure we continue to keep these rooms where they should be.
So is that on our website, that vacancy?
Yes, ma'am.
It is.
Yes,
And
ma'am.
it's been there for a while?
Yes, ma'am.
I had an opportunity, not good, to come into the ER. It was the 2nd or 3rd of this month. The experience, as far as the nurses, I don't know why I looked for Courtney.
Nurse.
Where is Courtney? I was hurting and I wanted to see Courtney. So anyway, and I asked for Dr. Conrad. But anyway, the doctor that was on duty was very good. It was very good. I was taken into that first room on the left.
Oops, sorry, on the left. Okay.
The bedding, everything was fine. Although I was in extreme pain, I had a naval abscess. They found out later. But I looked down at the floor. They should look like this.
Yeah. That's what.
And I'm not trying to be ugly
No, no,
or
no.
anything like
No.
that.
These
And then
floors-
I had it. I'm not done.
Go ahead.
I
Sorry.
had an opportunity. I didn't want to be. I wanted to be fair. I had an opportunity to come back and look again when I was recuperating. Then this morning I passed Dr. Conrad going to that same room. It needs to be taken care of. Not only that room, but all our rooms need to look just like that. And if we don't have a person to do it, now when I worked for Nationwide, they told me that if somebody is out, then it's no excuse for my job not being done. It fell on me. That's all. Like I said, I'm not trying to be.
Oh, no, I understand. No,
Yeah.
This has been an issue. These floors are slap wore out. We can buff them, put a wax coat on them, and within 3 days, they'll look right back to this. And that's what Mr. Walker and I have been talking about. We've been working with Carpet One out of Tallahassee, and we are going to start putting this new flooring down. And we won't have to bring all these buffers out and close the rooms down and interfere with them, because it's going to take half a day to do a room at a time and let that dry out. But there's a process to it. But absolutely, yeah. And I know what you're saying. It does. And I get out there with them. The product that we use, it's a sanitizer more than a cleaner.
Oh, I see.
And that's part of the problem. We did just recently, my new hire, he has gone down and he did all the patient rooms, got them swept, mopped out yesterday, and got a new glaze on them. So they all look really good. They're still dingy under there, but it looks 100% better than just like it is now. But we're working on that process. And
Craig, there's a lot of new products out there.
Yeah.
Versus this right here.
Oh,
Don't
absolutely.
require
Yeah.
the wax.
Well, if you notice in the mammo
Stripping
room,
and all that stuff like that.
yeah, in the mammo room that we've done, and also the X-ray room, that's the product we've been putting down, and that's what we're going to continue with.
I'm gonna look at that before we leave.
Yeah, yeah. The mammo's right there, on your right. But
They
you
got
can
them
look
for
at
food
that, and
service too.
that's the product. Yeah,
And they-
we were going to start on doing the patient rooms first,
Right.
and get those done, and then we'll close down an ER room at a time and have that done also, and then
Okay,
we'll
good.
come out into the hallway and just keep going with it.
And also with the rural health money that's coming out, that we're gonna apply to get out my office and the next office retrofitted for the CT. There is some money also that we're gonna see, can we apply to get the flooring done in here with that particular money? Because that's something that we
Need it bad. You
that's
can't
something that
make
we
them-
have talked about.
You can't make them look
Yeah,
clean.
yeah, especially in
Yeah.
ED.
What's the dollar value of that, of that floor replacement?
Let's see.
Stripping it all the way out, putting it all back in, and
room shut down. So pads, wax, stripper.
Do we have an estimate? Do we have some knowledge of how much that's gonna cost? How did we
No,
get
because
hooked up with carpet
yeah,
one?
yeah, we do it. I mean, we've done it so long here. Of course, we had more help.
Oh, Chris, no,
Yeah.
he's talking about, are you talking about how much the flooring cost that we put down already, or how much?
Carpet one, you brought up carpet one.
Yeah, but
Okay.
what's the price
There
of
are
the flooring?
many other locations or vendors that supply flooring. My question is, did we bid it? Did we look? And how large is the project?
But the reason Carpet One came up is because they do all the TMHs, and they're giving us TMHs discount. And they have, the guys that put this flooring down, this is all they do. They're doing 39 rooms of TMH right now. That's the only reason I haven't had them down here doing the other rooms.
Thank you.
Thank you.
Thank you, Craig.
All right, thank y'all.
Let's take a little break right here. got a question before you start. Just to make sure when I'm looking at these financials that I'm understanding this the right way. Depreciation is an expense, correct?
That is correct.
Okay, and it's no tax benefit to us and don't cost us anything, except, okay, I would guess depreciation because we have to do it. Okay, so you have,
Correct.
when you look at the financials, and you have your gross revenue, take the expenses out, then you have net revenue, correct?
So yeah, so you have your gross revenue, then you have your contractual percentage, your contractual allowances.
Right.
That brings you into a net revenue number.
Okay.
Correct.
Included in that is the expense of depreciation for net revenue.
That would be down in the expense section after the net revenue. So to get to the net income line, yes, I know.
So,
Okay,
so
yes.
money in our pocket. So I look and it says we have deficits, but we still have cash in the bank.
Correct.
So, Tom, what I'm asking to clear it up for me, and I don't know what's required in the financial. Could there be a little asterisk at the bottom each month or something that said net revenue without the expense of depreciation? Would that give me a clearer picture of exactly how we're doing?
We can put another line on there to.
Well, it would be too much to do. I mean, I don't want to.
No, we can do that.
Do y'all understand what I'm talking about? I know
You're-
John does.
You
You understand?
Exactly. He wants EBITDA. Exactly.
No, I want a clear picture.
But-
you know?
Yeah, so it
To
would be,
me.
it would be somewhat modified because on EBITDA, it's going to be above the line. It's not going to include the tax dollars. And so
No, I don't
yeah.
want to modify the
Right.
report. I want something that just, I don't want to modify the report. Just something there where I'll know more, and I know we got some, I guess the clinic at Carabel would probably be one of our major, for appreciation, I would guess. And I guess, what's the threshold for equipment? 50,000, 100,000, I mean.
5,000.
So you start appreciating equipment too, right?
Yes. Equipment,
Over the
building.
life, okay, all right.
Correct.
So-
But a lot
So
of
in my
our,
opinion, I'm not getting you have a rental house, you depreciate it. You own the house, the only reason you depreciate it is for tax purposes, right? And you can make money on a rental house without showing nothing for a while anyway, probably. I mean, depending on how slick you are. And I'm not saying us be slick because we don't no need to, And so it would really help me. Would y'all like to see that? I mean, do y'all understand? Bill, you understand what I'm talking about?
I think if you put on there a cash flow statement, that would answer his question.
just a statement of cash.
Yeah.
Yeah. We can put a statement of cash flows into the reports.
I mean, that's kind of what he's asking for, right?
To a certain extent, I think, but I think he's also, he's trying to pull the depreciation out and say this is our earnings without the, the actual earnings, because the capital equipment that we're getting and everything, we're depreciating it, but we're also, in recognizing that as expense over time, but we actually get revenue from grants and things like that that actually pay for it. So, it does kind of muddy the water per se from an earnings perspective from that view, but yes.
Yeah,
So-
we gotta have that there for the revenue for the.
That is correct.
Exactly. But it would sure clear it up in my mind, because we built a new addition here, we built something for $10 million. It's, it's gonna be a tremendous, quote, loss every month when you put expenses in there. If you just Facebook value, so.
Right. Yeah, the depreciation is going to go up tremendously, and it's going to show on the
Okay,
financials. Correct. I know exactly what you're
If we
saying.
could just get that where I could look at it a little better there, I'd appreciate it.
Absolutely. Yes.
Thank you.
Definitely. Okay. Yep. balance sheet. So cash did drop down from a couple $100,000. Can't hear me well. Is that better? Okay. So cash dropped down a couple $100,000. This past month was because we pay payroll every 2 weeks, not twice a month. Every now and then we have a 3 payroll month, which means that the cash is going out 3 different times. So that was a big reason for the reduced cash this go round. So, we're at $1.4 million of cash in the bank at this point in time, which is equivalent to about 43 days. The accounts receivable, they're running about 3.2 million at this point. It's fairly consistent month to month. It'll fluctuate up and down, but no major changes. We jump down to the liability side of the balance sheet. We did accounts payable did increase about $100,000. Just timing. Quite honestly, 541,000 in accounts payable is a very small amount. So we definitely pay very timely, and in fact maybe in some instances maybe we pay a little too timely. Some instances we try to hold as long as we can, but some people really to pay, yes. Our biweekly payroll is about, I had to think here for a second, probably about 400. I want to say that's about right. No. Biweekly. Probably about 200, 225, 230.
400 a year.
Yeah, 225, 230. Yeah.
Multiply that by 26.1, then we've got what our annual payroll is.
Correct. Yep. So, and this month our salaries were actually up. I mean, so we can jump down there and talk about that for a second. So our salaries were at 482,000, and that's high compared to what we've been running. We did have a very large PTO payout. For a previous employee that left us, that had a large bank of PTO hours. So that played into this. Another thing that's played into this is, we don't have, this was the first month, and I can't remember when, that we don't have any travel nurses in the financials. So, we are staffed up, so, obviously, you don't have travel nurse expense down below, it's going to hit up above. So that's been a piece of it. The other things that are factoring into it is we have added a whole bunch of employees here recently. We've filled a lot of positions. And so, a lot of that is really paying off, and it's going to take time for it to fully pay off, though, in like the clinic. So, when we get into the volumes, you're going to see the clinic's visits were 629 visits. Well, it wasn't, but just a few months ago, we were running about 400 visits a month. And so from that standpoint, this is, circumstances obviously has played into that increased volume, but you got to have staff to be able to take care of it. And then if you don't have those visits in the clinic, that's where our referral business into the hospital comes for things like our labs, our imaging, any injections that we may do, really, the mammography. I mean, mammography was, I think it was at 30. When we get over to that report, we'll take a look at that, but that's growing as well. So, not, every one visit in the clinic isn't going to automatically result in all these different additional services in the hospital right away, but over time it will. So we're kind of investing into the future here. But we do have to be cognitive of the costs that we're spending right now. Another thing that's factored into our salary cost is we've had a lot of increases in wages for different service lines, such as you know, obviously we were way behind on nursing, so we made a real effort to try to increase their salaries. Um, we made an effort to increase EMS as well. So that was a big deal. And the EMS increase is an attempt to try to reduce overtime for those folks, which will eventually reduce the overall cost. So we're still working through that, you know, but in the meantime, we have to be very careful with our spend at this point in time as our volumes continues to grow. So, all that said, you know, one of the areas we talked about earlier, the revenues on the ambulance, on the EMS, it is down, and we did talk about it. I don't know if there's any other questions regarding that revenue, but we're definitely looking into it. It's an area that there may be a valid reason, like fewer miles or you know, the stops that we're picking up are lower acuity stops, but we're looking at all of that to kind of make sure that the coding is accurate, that we're picking up all the miles, and we're billing everything that we should be billing. So, bottom line, we ended up losing $87,000 for the month. So, you know, hopefully, you know, that will hopefully we'll see that trend. That's 2 months in a row we've actually lost money. So we want to try to get back to the positive line on this. So, you know, our expenses are high, but we did do a good job of managing a lot of our other costs. If you look down through there, a lot of our other cost lines are down compared to previous year. And so, you know, so it's most of our increased costs is sitting in the area of salaries and wages and benefits. So, you know, again, investing into those employees who, quite honestly, are going to be the ones who help us get to the next level of care that we continue to provide. So.
Well, on the positive side, Tom, we're still year to date 406 to the good.
We absolutely are. So it's in my mind, I want to continuously be, I always want to have a positive bottom line. I mean, that's obvious. And we haven't really seen that in years past, and especially over the last several years. And so now we're starting to actually hit that. We're actually having one of our better years that we've had in a long, long time. But better is not where we're trying to be. We're trying to constantly improve. So, and I think we're heading down the right path. I know that we're doing a lot of physician recruiting efforts and things like that will also play into this. But again, that'll be an investment when we do that. And so we'll just have to be cognitive of some of these things as we move along.
And I just want to interject with saying that, really last month, with the data we're looking at now, and then when we look at April's data, our numbers are going up on the outpatient level. Those numbers are going up on the clinic level. The days are going up internally, so we should be seeing a higher cash flow, coming into looking at May as you begin to look back at April numbers as well.
And that's true. And then, so another real positive that just happened this month is we finally renegotiated and signed, as well as they've signed as well, the Blue Cross contract. So they're going to go back a year and a half and reprocess those claims for the past year and a half and repay on the new rates. So we should have an additional cash influx from that. So that'll be important. And just looking at a few accounts just yesterday with Heather, there are several inpatient and swing bed patients that came through that Blue Cross. So I truly believe that we'll easily have an additional $150,000 check that are from Pratt for the last year and a half that we'll end up getting at some point. So it was a very long process to get to this point, I got to tell you. But we finally got through, and thanks to Nick, the gentleman who we utilized to help negotiate contracts for us on managed care. So, okay.
Tell me just one line
the tax money's not shown on our balance sheet from the county. That's not sitting on our books. And you know, I'm gonna have to just double check before I throw a comment out here in a one line. Yeah, to make sure that I don't accidentally give an inaccurate statement.
Well, this is a pretty big number, 6,231,000.
Yeah, so that the 6,231,000, that's the total fund balance. That's just the you know, that's basically the retained earnings.
Then you have 9 million unrestricted now.
Right. Yeah, and that's why I just want to double check to make sure. That was the number that I was. Yep. But I appreciate that. Okay. Any other questions on the financials before I jump over to the dashboard? All right. So, second here. Okay, so the dashboard is also in the books as a PowerPoint, as well as just the dashboard report. But you know, our total incoming cash this month was down slightly. You know, I actually think that's just more or less just the timing difference based on, because this is cash basis. You know, so we collected patient cash of about 500,000. Previous month it was 822, which was great, but you know, obviously, you know, timing's going to play into this number from a month-to-month basis. Total cash that came in was 724,000. That includes the tax dollars as well. Days cash on hand 43. Our days in AR did go up slightly. I did want to talk about this real quick. You know, as we've been going through the audit process, I think, you know, really that's kind of it's pulled us away a little bit from some of our efforts in the business office, and so you know, there's only so many hours in the day and so many people, so it did slip slightly, but I fully expect that that's going to go right back down again. So it's not a big swing, but it is a swing up nonetheless. Um, the volume, so we did have 7 admits during the month, which is down from the previous 2 months. But this current month that we're about to close, finish out right now, I think it's going to actually have a little bit better volume number on the inpatient side than what we had seen, you know, in the month of March. The outpatient visits, 351. So this is a result of a lot of the efforts that are going on with trying to, you know, with the clinics, because, you know, most of these are going to be coming from referrals from the clinics. So, you know, as the clinic volume grows, our outpatient visits should be growing as well. And as we continue to add different services, I think that's going to play into this even more so.
Yeah. And also, some of the outpatient visits, they're also coming from other providers in the community. And so we're, you know, our clinics now, they, you know, we do the lab work, you know, for our different clinics themselves. They do that in the clinic, but different providers in the community are sending people here for other, you know, outpatient service like radiology and things like that. So that's good news for that.
And I appreciate you saying that, David, because there's one other thing that I truly believe is playing into this as well is, you know, we've had Dan going out there and he's been marketing the swing bed program. Well, he's not just marketing the swing bed program. He's talking about all the other services that we provide to these different providers in the community to let them know that, you know, don't just send us your swing bed, but send us your imaging, send us your lab, send us whatever, you know, whatever we can provide. You know, we have mammography and a lot of other things here. So I think that that's absolutely playing into this as well, and I think you know, that's part of this 351 outpatient visits. The emergency rooms fairly consistent, 425. It's up slightly, but you know, emergency room visits typically aren't fluctuating a whole lot. So you know, but the billable ambulance runs did come up 104, but if you actually look at it compared to the previous year, and I know that's not on here, they are down still. Um, March is just typically a busier month. Um, so, obviously the runs have been down all year, as we talked about, 12.5% year to date, for billable runs. So, things that we're just having to continue to try to investigate and try to figure out, the reasons why. And it's kind of hard. That's a hard answer because, if the volume's consistently steady in the area, what would cause the runs to go down? Is everybody just a little healthier and not needing services? Are people driving themselves? It's a lot of different factors that you really can't just put your thumb on it. How do you really know that that's so? So anyway, we're trying to dig into it as best we can.
I mean, it is weird because you're talking about the actual runs are up, and the unbillable versus billable is still 54%. So it's not like the unbillables went up.
Correct.
It's a
Exactly.
conundrum.
It is. It's just one of those things. We continue to look at. We're not just ignoring it. We're looking at it as best we can.
Do you have times that, on EMS that they can't make a run because all the equipment's in use?
Um, you know, that would be a good Randall question. I know in the past there have been, challenges where if all of them were in use and, so, that they couldn't get back timely. I know there's a lot of late runs and things like that, but about not making the run, I don't know if we've never actually not made a run, but that would be, honestly, that's a Randall question that we'd have to
You
ask.
don't have equipment, you can't make a run. How does that affect this?
Sure.
I mean, if you're limited in your inventory of vehicles, you can't do it, then it's gonna drive your number down.
That is true, assuming that.
We have a situation like that.
Well, that would be assuming that in years past we had more equipment, and we didn't have more equipment in years past.
Or less long time runs.
Yeah, the number of runs, but then that's why we're looking at the miles and yeah, there's a whole we could really go down the rabbit hole on this one. But I appreciate
I
that.
think the rabbit hole has got to be looked at in the EMS, from what you think I heard.
Yep, absolutely. So, which we are. Anyway, okay. So the clinic visits, I said, were 629. So if you look across at the previous months, I mean, that's well above any other month that we've seen this year. So that's a big deal. And really, as time continues and everything, we expect that number to continue to grow as well. It's important that we're actually providing that access, to this community, and make sure that we get these patients into the clinic when they need to be seen. So we'll continue to try to provide access. If you go down to the key project status indicators, obviously the Carabel retail pharmacy is kind of on hold at this point. We are doing some analysis to determine what the profitability or lack thereof potentially would be if we dropped our critical access designation and went rural emergency hospital. Because in that world you lose 340B, and so that could be a major hit on that pharmacy. And so we just need to make sure that we know what it looks like and that we can communicate it to y'all as well. So mammography, so it's at 30. We had 30 mammographies this past month, so that's continuing to grow. So that's a real positive. So we're very happy about that. I see this as one of those preventative measures that says, the more we do, the more we're preventing negative outcomes later on in life for our community. So that's a big deal. Physician recruitment's on here, and I know David will be probably talking about that here in a little bit. So I'll leave that one to him. The infusion services program. So I highlighted that one yellow for the first time. And That's because if you look at the trend is absolutely going down. And, so we basically just need to kind of do more marketing efforts with this to try to promote the services and to make sure that people realize that, because this is injections, it's infusions, it's, it's both. So, um, you know, obviously, that's going to be important for us. So.
Yeah, I think we're working on a brochure to get out to some of our other partners in the community. And I know Colleen has reached out to a couple of the social service programs and health um, maintenance programs in the community, and they all would like to see our list of services because those are great referral sources to bring back to us. So definitely, if we could get that printout that we're looking for about the hospital services into the hands of the right people in the community, I think that will help with getting infusion services up and some of our other services, outpatient services up as well.
Agreed.
Yeah, and just, Christy, Terry, I think that should be going into print now.
Right.
That brochure, that's gonna be very helpful. And they have the contact names.
Yeah, and especially since with the health fair coming up, it's a good place to
Yeah,
hand out that information to those partners that are here.
yeah, yeah. Yeah, because the healthcare, I guess Bill will talk about that a little later.
Yeah.
We have a bunch of partners. Colleen mentioned yesterday, I think, how many, 20-something partners now?
Oh, more than that, there's 30 something.
Oh, 30-something now. Oh, 34, yeah.
I think, yeah.
Yeah, 34 and counting, so.
I think we're ending that. We're running out of space.
Okay.
So, okay, then chronic care management. So this is continuing to grow, and it's a good thing. I mean, we're at 80 people that are currently enrolled in the chronic care management program, and so that's a real positive. Again, this is another one that I kind of associate, just like mammography, as looking at an indicator of how well we're doing in preventative medicine and making sure we're taking care of our community, so that they don't get very sick or sicker in the future than what they necessarily should, or maybe
Our
that's a bad
chronic
word.
care is run out of the clinics, is that correct?
It is. It absolutely is.
Be for diabetics and,
Yeah. So anybody who's got some sort of chronic condition,
Right.
we can get them enrolled into the program, and we'll do monthly calls with those individuals to talk about what's kind of going on with their health and things like that. Try to make sure that they're getting their prescriptions,
Right.
refilled. Trying to make sure that they're getting their preventative
Okay.
services taken care of. If they need a mammography, then we try to get that taken care of. If they need a colonoscopy, obviously we don't provide that service, but that doesn't mean that we don't try to make sure that we make the appropriate referral to somebody who does, and that'll be an area that obviously in the future we may want to look at offering. It's going to be a little more complex to go down that path anytime real soon, because not only do you need the provider to be able to do it, but you also need the nurses to be able to do it as well. And it's not just taking somebody off of med-surg and sticking them in a surgery suite and doing a colonoscopy. It's not the same. So. So from that standpoint, there's work and expenses that would have to go. It'd be an investment, but it would be a good investment if we felt like we could recruit those nurses. I honestly believe it's more of a nurse recruitment of the appropriate people challenge, because I think we can get providers that could come in and do it. And as far as the equipment, the scopes, and everything, I'm sure we can get grant funds to kind of cover the cost of that, just like we've done in so many other services. So, at any rate, that 80 is actually, as of earlier this week, it's actually at 99. So I would venture to say, as we stand here today, it's probably over 100, but I can't, honestly say it for sure. But so it continues to grow, and we'll continue to push this service as well. So anyway, that's my report. Any questions?
Where's the payback number that we're having to pay? Where do you have it buried in here as far as the payback to the state of Florida and the federal government or I guess we can own
the lip, the withdrawal.
Yeah, yeah, so, no, that's not in it. No, we are not making payments yet, but I appreciate the question. No, we reduced, our accrual, for, we were accruing for this year, so it's basically about $54,000, a month that we were accruing. That there's $0 we're accruing on the lip, component at this point in time. So we've backed it out, on our accrual basis, and then but to answer your question more specifically, that'll actually be an adjustment in the audited statements for last year, not in the current year.
That will make us look,
Worse
more
than,
of a deficit or.
actually, I think, we're gonna be fairly close to break even after all adjustments, cost report, adjustments and everything else, for the last fiscal year.
Now, that'll be explained in the financial statement,
In the audit,
right?
that's correct.
Yeah, and also for the lip payback, we're waiting on the state of Florida to ACA. They have to contact us again and say, okay, here's the payment options for you all. But we hadn't heard yet, and I'm thinking maybe one of the reasons because they had that big healthcare, cybersecurity issues. So a lot of hospitals, they had to have payback. Some of the bigger hospitals, cash flow was very, very low at that time. And so we hadn't heard yet, but we should be hearing something soon.
You're set up a reserve.
That's all on the, that's gonna be on last fiscal year's books, not on the current fiscal year.
So you had to go back and restate?
No, we're waiting for the audit. It's gonna be an audit adjustment on the last fiscal year. Yep. So no restatement, just an audit adjustment.
Does it only affect last year?
Well, we've stopped accruing because we're not 100% sure where it's gonna go at this point, so that's why we stopped accruing.
It impacted the year 2017 and 2018. But then the state also may look at 18 and 19. It all depends on the lawsuit with CMS in the state of Florida.
But all those adjustments are going to be as an adjustment on the financial statements for last fiscal year.
So basically, the numbers we're looking at still have more adjustments.
Not on the current financials, on the previous fiscal year's financials.
Which changes those, you go back and.
Do a year-to-date
graphs,
comparison.
Those graphs get changed.
So those graphs do not have, those graphs, the only numbers on those graphs that actually would take into account any of those monies are the cash dollars. And so yeah, anything that we have to pay back, we would reduce in the current months that we're paying, because it's a cash-based look that we're looking at on the dashboard, not a, it's not a, an accrual-based.
So is there anything that we're having to do accounting-wise that's affecting these numbers as far as our cash today?
No, other than we reduced out of just knowing that there's been adjustments and everything, everything that's from the past that's known is going to be an adjustment on last fiscal year's audited financials that when they do the audit. Going forward is what we're accounting for now. And so from that standpoint, based on really not having a good answer as to whether it will or will not impact us, we stopped accruing for the lip payment. So there's no adjustments that are going to need to be made necessarily. In fact, my guess is we'll probably end up, we'll still get a lip payment, and we may end up being under accrued for what we think we're going to get because we're trying to be a little on the conservative side at this point. Yep. Any other questions? Okay.
Yeah, I
Very-
got one.
oh, yep, sure.
The county EMS subsidy, ad valorem tax,
Yes.
what does that actually pay? That don't pay for ambulance, correct?
Yeah, the ad valorem is for EMS only.
EMS only.
EMS only, correct.
It'd be
And
salaries.
Yeah, it's, the operation, it's salaries, fuel, just the operations of EMS. And so,
Rent, how about rent? We rent that place over there, don't we?
I think we bought that trailer that they're in. Yeah, any rent that we actually have would be part of their operation. It's gonna hit their books.
It's been the same since 2021, and inflation's hit pretty hard.
Correct.
Wasn't that, my memory might not be good, but wasn't somebody gonna look at that,
The auditor,
huh?
Brian Hall.
Yeah, did he?
He did. He met with each of the commissioners. If I'm not mistaken, I think, John, you got to attend a couple of those meetings as well, if I'm not mistaken. But he did report on that, and over and above the.
Have you received a written report on that?
I've got some spreadsheets that he utilized. It's not a written report, but I've got a couple of the spreadsheets that he shared with me. And depending on how you account for like the overhead, like if you were to pull this whole service line out of the hospital and try to do it separately,
Oh, yeah.
there's all these things that like the oversight, a lot of the staff and everything, the housekeeping.
Yeah,
the
I don't, yeah, but
all, if
we
we try to
have them
allocate.
staff anyway. You
Right,
know,
right,
it's
right.
just extra
We
duty.
have it, so, yeah.
That, to me,
It
I'm talking about
loses-
the hard dollars there.
It loses, probably about $300,000 more than what the ad valorem tax covers. And I'm sure that's probably what you were seeing as well during the presentation.
765.
Mm-hmm.
Grant loan, 765,000.
Correct.
That ideally that wouldn't have to be tapped and coming out of the hospital operations.
Is that what the conversations were?
Well, it's not so much a conversation, that's just my thought process. So it puts no money back into the county's ability to fund other areas or increase certain areas that are needed.
Right.
Where we're sitting here, and there's nothing to do with the 50/50 rule. There's no 50/50 rule that we know of.
No
I've
what?
heard that 50% off, of sales tax, 50% for operations, 50% for capital.
I'm not talking about that. I'm talking about the ad valorem for the,
That's what, you and I are on the same wavelength. The ad valorem, if you move that over to the hospital tax, then that would free up $765,000.
I'm not even talking that way. I mean, what I'm talking about is when you look at our bottom line here,
Correct.
that's not a clear picture of what the hospital's doing,
Correct.
okay? I mean, to me, all I want is some realistic looking at these numbers here.
So
know,
in these
by
financial.
everybody involved. And personally, I ain't figuring, I don't care where the money comes. It's like putting your left-hand pocket to your right-hand pocket in a way. But we would have $300,000 more in our, and I'm not talking about the administrative, we already got that. We're paying them salaries. We're not having to create
Correct.
positions or anything for them, and just have to work a little harder. But 300,000 over 10 years is a lot of money.
It is. It is.
I mean, that would be in on our financials right now.
That is correct.
1, 2, 3, 4. That'd be, what's 300,000 times 4? Come on, somebody.
Times 10 is 3 million.
1.2
$3 million.
1.2
I knew that.
1.2 million.
But I'm saying that we would have that.
So,
The way I'm looking at it, through my eyes, that would be in our cash.
yeah, what is happening, the
That's
hospital.
also coming from our net revenue.
What is happening, the hospital is subsidizing the loss of EMS. So $300,000 that we put in, we're subsidizing that hospital operations. Now, that's what I'm thinking. I'm not an accountant, I'm not the financial person, but that's just, they're short $300,000 a year. That money comes out of our pocket. County,
Out of the
operations,
side
yeah.
of the tax collection
Yeah.
for the hospital.
Yeah. And
Doesn't affect the hospital. It affects the fund with regards to how much is collected for the hospital.
yeah. Well, the hospital, if you look at what's collected for the hospital, just say what we had about, it should be on the
Affects the hospital. We're giving X amount. we're
Yeah.
giving a 50% cut, right? That was an arbitrary number somewhere, which I'm fine with. It was fair to me, but that doesn't affect that fund any. It affects what we have in our operational revenue.
Correct. I mean, that fund, whether or not the EMS is running at a profit or a loss or whatever, has been at 50% regardless.
EMS don't run at profits anywhere.
It
I've ever
doesn't.
heard of, you know. I mean,
It
just
doesn't.
don't.
But just as an example, though, that
I
fund
wanted to get
does
that
not
clear
change
in my mind
at this
right there.
point.
Okay. Okay.
So technically, let me just do some math here. So last year, fiscal year 2023, we got.
It doesn't.
You know, I mean,
It
just
doesn't.
don't.
But just as an example, though, that
I
fund
wanted to get
does
that
not
clear
change
in my mind
at this
right there.
point.
Okay. Okay.
So technically, let me just do some math here. So last year that we do get, you know, that's kind of like knocking $300,000 off that number we get because we subsidize EMS. So that's
This
just.
is Apple, yeah. That comes out of Apple. Okay, I'm fine with it. I just wanted to get
I was
clear
just
with
trying
it.
to
I wanted to get,
make it clear, but.
you know, and to me, I don't think we should, I know you talked about what, if you pulled it out completely, but we already got staff here used to doing that and everything. But if you pull it out completely, somebody's gonna have to run it, bill, and, I mean,
Well, and the nice thing about the fact that this is a sales tax, it's not a property tax or anything like that. This is coming out of tourism. This is tourism taxes at the end of the day. I mean, because most of these sales, you know, I mean, my
no, it
visit
ain't a
down
tourist
here
tax.
is-
It's my penny too now. Everybody,
yours
you
too.
know.
It's everybody's.
That ain't no tourist tax.
That's
now.
exactly right. That's exactly right.
But the idea is that the $765 that we get for Everlorum, that we can take it out of the healthcare sales tax money, and then that $765 we don't have to pay it as property owners towards EMS. I mean, that's what I think. John, is that kind of what you're thinking?
How much is sitting over there for capital improvement?
Over on the county side, I want to say there's $11 million sitting over there. Plus.
So you got 11 million sitting down here, you got running a deficit of 300,000 over here. So whether you got 11 million, you take 760,000 out of that 11 million, or that annual basis, what you're doing is freeing up 760 for the county, you're putting it over here, and you got less funds for the hospital improvement as far as the capital funds.
Right, yeah. So I think if you took the full 764,000 out of that county side, I mean, that's the accumulation of funds over, how long has this tax been in place?
2007, 8.
So, you know, that's accumulation in the fund, you know, and so now I guess we're kind of going down a path, but, you know, those are intended to try to do some sort of construction on a new facility for Apalachicola. And I know that's kind of how that tax was approved and everything. So, so I think there's a whole lot more to this than just.
Yeah, aren't they restricted funds, though? I mean, they're restricted for capital improvement. We can't just use them for operations, can we?
No.
They're not
I don't
restricted.
know.
And I think really that's more so, you know, this is outside of our purview. This is not our responsibility. This is really the responsibility of the county, and I know the county is trying to do the best they can with everything that they're trying to work through and everything. So, you know, we appreciate them and everything they're trying to do.
The only thing I'm trying to make is we're not getting an accurate record of what it's costing to run this hospital.
That's correct.
We're 300,000. That's the only thing that I think that needs to be mentioned right here. I'm through with it. That's good.
Right.
That's it.
Yep. Great. All right. Thank you.
Thank you.
Good afternoon. We covered a lot of, I might finishing them, well, it all depends how long. You'll be on after me. I just want to just bring up my report here. We touched on a few things in my report. One of the things that I want to bring to the board, as for approval, we have a request to purchase a claims data analytics software dashboard using funding from the Department of Health, State Health Improvement Program grant. The grant is $7,000. The software costs $15,000. The software will allow us to plan for growth opportunities using a data approach. I sent this out to you all, and this is a conversation that we've had many times, and we got the information from Belinda, who did our strategic plan, but we've had this conversation about how can we find out, the number of individuals that migrate from our county, different services they receive in different areas, and then how can we bring these services back into the county. At the last board meeting, Bill mentioned about, how can we find out how many individuals are being referred into our outpatient setting. Some of your bigger hospitals use a system like this. A few years ago when I came on board, TMH had pulled some data for, I think, a Lion at that time, and it showed about like 60% of our patients going to Tallahassee, for different services. And I've been in some conversations with TMH at that time to find out what kind of platform they use. Of course, the platform they use probably, costs about $50 to $60 to $100,000. So some of your bigger organizations use platforms like this, but this will give us a smaller platform, and we can begin to pull data from 4 county areas, claim data, Franklin, Gulf, Wakulla, and I believe Liberty as well. And we have about $11,000 that we need to spend, and so we think this would be a good opportunity to spend this, and then we can come back, give some reports to the board, when the board asks, what kind of specialty service do we need in Franklin County? You can pull that data, you can say, okay, Franklin County had 70% of people leaving this county and getting cardiologist kind of services. And you can pinpoint, maybe we need to start a service in this area here. It also can go even further. We just trying to purchase a small, bare minimum of it that will give us the outpatient data. It gives you inpatient data. We're really not really looking at inpatient per se, but we're really looking at the ambulatory outpatient data service line. And like I say, some of your bigger hospitals do use this, like Erlanger. I'm sure they use this particular model here, but they probably buy all the things that go with the suite here. But this is a good start for us. So,
David, one question. Is this a quarterly report or an on-demand report? How do we access it?
Yeah, it'll be a quarterly report. Then I can also have them do some special projects, on demand, but it'll come out quarterly. Oh.
I'm not quite understanding.
Okay, so we're asking, we have a state health improvement grant, technically, and they give you different items that you can spend the money on. And one of the items that we picked was analytic software, some software that we can analyze data, claims data, per se. So when we want to plan different service lines that we want to implement here, instead of shooting out of the blue, you can look at the data. How many people leave this county for, say pulmonary services. Do we need to start a service line like that? Orthopedics. You can begin to plan your service growth around your claims data, meaning that this system here will pick, everybody that go to different specialty groups. If you're going to a outpatient clinic setting, they review that data, and then they review reports saying that Franklin County, you have 60% of your people leaving this county going to Tallahassee for a certain service. You have 40% of your people leaving this county going to Panama City for a certain service. Then you want to try to build your service lines with that. And usually you also use it for strategic planning purposes.
And why are we losing infusion therapy patients? I mean, that's a good example right there. So you could look at this report and say, where are they going to, and why are we not capturing that market?
Yeah.
Right?
Yeah.
Planning to, like if we did get the physical therapy, would that probably be good with the physical therapy?
Yeah,
people are leaving.
it'll be
Because
good.
there's nobody here, that's one.
But yeah,
reason.
there's nobody here for physical therapy, so that may be a good one anyway to start, but you still want to look at those numbers. You know, because it may be a smaller number than you think. You know, just because we don't have certain things in the community, you know, we automatically think we need it per se, but when you run the data may say, well, you only got 2 patients. that
Yeah,
leave
I
it.
got
It
you, I
doesn't make any
understand,
sense.
yeah,
for that.
yeah.
So where does this data from these different hospitals go that allows this software to go forward?
Yeah, they look at your Medicare. Go ahead, Tom. Your Medicare, your commercial claim data.
Yeah, so basically, a lot of the data comes from your cost report that everybody has to file. And so there's a ton of data that is driven from that. A lot of data is also pulled from required state reporting indices that hospitals submit up and as well. So it's accumulation of data that's reported either directly up to the state level from the hospitals or from the cost report.
But this company has to have a license to go pull that data from from the state of Florida, with the state of Florida? Or, that's a private company, right, HSG? So, if it's a private company and it's gonna go access the data, don't they have to have an agreement or something with some other entity, governmental entity to do this?
As far as that side of it, I'm not familiar with that side of it, so I can't really speak
Are some of
of
those
it.
reports public,
Yeah.
required public information, so therefore, maybe that's why they don't need a license to go pull that?
Yeah, because technically, when you submit data to ACA, that's public record.
Right.
Technically, and so people can go and say, okay, send me your claims data. I know the Florida Hospital Association.
It's not individual names, it's
No,
numbers.
no,
It's
no,
talking
no,
about
no,
numbers.
no. I know what you're saying with that. For example, Florida Hospital Association, they have a analytic software, and they scrub all the data that all the hospitals send to ACA, per se. And so companies like this, and there are many other companies, like I said, your bigger hospitals, that's what they pull. You know, your big Ascension. That's how you know 20% of people in Franklin County goes to Sacred Heart. You know, people can pull that data like that. So this is something that your bigger companies, hospitals, they use this. You know, smaller hospitals really don't use it. We have to count on experts that contract with people like that to pull that data, and they come back and say, hey, you have a primary care shortage here, technically. But publicly, all that data is public knowledge, for that.
Numbers, yeah.
So, I guess I'm getting too deep in the weeds. Bottom line, who tests their software to make sure it's correct and how it fits our needs?
Okay.
I mean, you just don't go out and pull data and say, here you are.
Oh, no.
Somebody wrote that software. What are their keys to go get the information that we need that's in a standard interface? Bottom line is, where is the IP?
So, with this, let me just give you an example also. We had Belinda come and do our strategic plan. That's before you got on board here. She uses this particular company to pull the data that she showed us. Hey, you have these particular service lines that individuals in Franklin County they're going outside to get service lines. So, like I say, this is just one company. You have many more, but you got to have the money to pay for it. Many bigger hospitals, that's what they invest in. They invest in when they want to come in and do any kind of service. They scan the land and they say, okay, where are the gaps at here? And that's how they begin to start the service.
Well, now, they say right here, utilize data from 2 distinct sources, commercial claims and FFS Medicare claims.
It'll be Medicare, your Medicare and your commercial claims.
Right, exactly. I think it's too, anytime I mean, I don't know how you would research. I think this is
This is a good tool to have because it tells you about your market share too. You know what I mean?
Is it the best tool?
Yeah, I think for us, it would be the best tool.
How does that get justified as far as, that's your process of thinking, may not be mine.
He's the CEO. He's the CEO. That, we pay him to look at that and make decisions like that.
Now also,
Somebody else should be able to explain.
okay, also, here's the deal too. I've had conversations, with, Belinda. I also had conversations with, another state office, trying to get them, say, hey, maybe you need to invest in a system like this with your rural hospitals. Because we don't have this, like the bigger hospitals can tell, what kind of service lines that, they want to implement in their community. Smaller hospitals really don't have that. So I've been in some conversations saying, hey, you all need to create something like this. So you can write, I can go online and say, okay, for Franklin County, what kind of specialty service that we're really missing in this area? How many people in Franklin County are leaving, getting this service? So then we can begin to plan, better, for better opportunities.
Tom, I'll ask you this question. Do any of your Alliant hospitals use this kind of service?
Yeah, so most,
I can answer that, yes. There may be various sources, or companies that they use, but most of our hospitals have a mechanism to pull what I call market share data, to be enabled to look at what percentage of the market share are we capturing, what are we losing, and why are we losing that market share? And then, as been previously stated, then we plan on those services because, and I'll use dialysis as an example. You may have a small group of people out there that says, oh, we need dialysis. We need a new dialysis center in Apalachicola. You pull the data and see that there's only 5 people in Apalachicola that are on dialysis. It doesn't make sense to make that investment, which is so costly to do it. So it's a decision-making tool. The other thing I think that David Walker was mentioning is, every hospital pretty much in the state of Florida and throughout the country, and they have what they call the SHIP grant. And that's what the grant is going to pay for some of the cost of the software. Now, they have stipulations on what it can be used for. You just can't apply for the grant to, paint the interior of the building, or you can't apply for the grant to add a personnel. So there's specific things that they outline that you need to use this money for. Some hospitals use it for quality improvement software, where they can track falls and other things. So it's used in a number of different ways, but typically all of our hospitals have some form of software that they can track market share data.
Okay. And I think it's a great idea to have this. It's certainly going to help us with planning and deciding what outpatient services we need to bring into the community. I think, John, I'm not going to speak for you, but I would think that you're asking the question, did we go out and get multiple quotes on this, and do we know this is the best program for the bang for the buck? Is that basically what you're asking?
That's basically it, Nathan, also. It's out of Lexington, Kentucky. Everybody's out of Lexington, Kentucky.
Oh.
Okay? So I'm sitting here saying, okay, who's the puppet master that's got all these businesses that are all...
Okay, yeah. Now when we did look at this, we looked at a whole bunch. We really went out to Belinda, because Belinda's an expert. We trusted his strategic planning for us. But initially, 2 years ago, I talked with TMH. TMH used a different vendor, but you're looking at $50,000 to $100,000. At that time, I was like, well, can you pull the data for me? At that time. So yeah, I really wasn't looking at Lexington, Kentucky. I was looking at the product that we need can help us begin to plan. That I know the board would also like to see, just some good information, that we don't make decisions out of the blue when you're trying to plan services.
You feel confident in this?
Yeah, I feel this is a start. Like I said, this is a start, and I did reach out to some other colleagues, that even run the Florida Flex program, to say, hey, this is what we need. But you all need to do something for all hospitals like this. But we have an opportunity with the grant funds to get this particular.
Well, are you asking for a motion to?
Yeah, approve that.
Okay.
So so we can
Well,
move
let's
on.
get do I have a motion
I
to
have
approve?
that motion. Approve it.
Second? Discussion now. Got ahead of myself. We done have some discussion. Any more discussion?
I think $4,000 is a bargain.
Yeah, I think so. Okay.
State up.
No more discussion. All in favor, say aye.
Aye.
All opposed? Motion, okay, one opposed. Motion passed.
Also, on F, number F on my report, healthcare consultants, Franklin County Board of County Commission will interview healthcare consultants during their May 7th and 21st meeting. So I think Sprout Water may be at their first meeting, the May 7th meeting. But I'll send you all emails to let you all know. That'll be a good chance for you to be there for Kansas to hear some of the interview questions there. And that's all I have. The next governing board meeting is May 30th.
One thing here, the outpatient physical therapy services,
Yeah.
can we put that on front burner right there? I think that would be a very
Yeah.
good thing to have
Yeah.
for the people, because you gotta go to, let's see, I guess to Crawfordville for CHP, maybe, might even be Tallahassee, no, I'm not sure. You go to Crawfordville, and that's it from here.
Yeah, Crawfordville, Tallahassee.
Tallahassee.
Yeah, or you can go to Sacred in Gulf County. You know, if you got Blue Cross Blue Shield, you go to Gulf County or
They don't
Tallahassee.
take CHP though, do they?
No.
That's the
No,
main
it's- yeah.
insurer for the county
Yeah.
right there.
Yeah.
And we'd have to take that.
Yeah, CHP, you got this, you'll be here going the opposite direction. And so we'll, they're creating some numbers, some financial numbers for the outpatient for us. And Courtney will review those numbers and we'll come back to the board, give you all the update on that. That's all I have.
Anything else?
Yeah, May 30th is the next hospital board meeting, but we'll send y'all some information regarding that as well.
Okay. Hey, can we take 5 minutes right quick? Just 5.
crazy on me, but I wanted to just basically give you an update. I think David probably shared the presentation that Mike Spiegler, the chairman of Alliant Management Services, and I provided to the county last week. And that presentation basically entails, what a critical, what a rural emergency hospital is. It also outlines, the differences between what a rural emergency hospital and the critical access, the differences, and what that would mean for Weems Hospital. And then we followed up with the third part of our presentation was to introduce the concept of a lease use management agreement that we would propose to the county to take over operation of the hospital. And just to give you a brief update, we are preparing to come back to the county commissioners with a proposal which would detail financial aspects of how a deal could be arranged with between Alliant Management Services and the county of Franklin County, Franklin County. So I don't have the details of the actual proposal ready yet to be able to be shared with anybody, but we are very interested in looking at what possible involvement Alliance could have, and I've heard many times from the commissioners for us to have skin in the game. We also heard that they weren't, the commissioners weren't really interested in looking at another management contract, but someone that basically is going to help, will basically, be responsible for the profits and losses of the hospital. So we continue to work on developing that. We're scheduling a meeting next week internally to go through some of the financial aspects of what that would look like. And then hopefully in May or possibly June, be able to come back to the county commissioners with our detailed proposal of what this would look like. So I'd be happy to answer any questions. I know I just kind of hit the high levels of it, but I did want to share that with you all this morning.
Michael, would you be sharing that proposal with this board prior to the county commissioners?
That would be our hope. Yeah, that would be, that we were. Let me rephrase that. That is our plan to discuss that with you all before we would actually take it to the county commissioners to make sure that you all were on board with what we would be looking at doing. We have experience in doing that. We have two hospitals right now, the one in Shipley and the one in Eufaula, Alabama. Eufaula, Alabama is probably a better model of how that deal is structured, where, up there they have a city hospital authority and they have a county hospital authority. And the city and county collect tax money to actually help support the hospital, but it is only a portion of what it takes to operate the facility. And so then we have a lease operating agreement. The reason we're in favor of that
provider number, which is the most important thing. And there's two reasons for that. It enables the facility to remain a nonprofit facility. It enables the hospital to participate in the 340B. It also enables the hospital to be a part of any state or federal grant that would come through there. And again, it also enables if something would go wrong, that the county would still hold that provider number. And if something would happen and they say, we want you guys out of there, they would still have the provider number and not have to go through the very difficult process of trying to obtain a new provider number and getting payers contracted and all those aspects of it. So, that's really the model that we would be looking at to be able to move forward.
And Michael, would that new contract in any way change this board's operation or function?
That would be determined. In all our cases, and I'll use Buffalo as an example. The city hospital authority that actually owns the hospital, we meet on it's every other month that board meets, and we go over things, and they do have responsibilities assigned to that board. Typically being a for-profit, it's a little different. They have an advisory board. That advisory board meets every other month. But it doesn't have the same, governing power of the follow facility. So there's, that is to be determined in actually how the board and everything would interact with that. But there would be a board. Let me say that. There would be a local board.
Is this a unsolicited proposal?
Yes.
Okay. Now, how does that unsolicited proposal, when you provide that, align with where the county is currently going with the healthcare consultant?
Well, we fully support the healthcare consultant coming in. I think it's a good move by the county to look at these individuals and the firms that they're selecting. I have experience with. They're good firms. They're knowledgeable. I think it will give the county an unbiased view of healthcare for Franklin County and what the needs are and how to be able to address that. I think that it's a good move on the county's part to do this, to look as they look at the future of where they're going. I know Stroudwater is a firm that we've worked with on other occasions. Baker Tilly, one of the other firms, I think is a very strong firm. The third I'm not familiar with. I think it's more of an individual. But I know those two firms are good, reputable, solid firms. And as I said, we fully support them coming in to take a look at what do they see, and we have the ability to do that, but I think it would always appear that we have a bias towards it. So I fully endorse them bringing that in because I think it will give them an unbiased really look at the county.
So we all go over to the healthcare consultants and we listen to their meeting and understand what's going on. What's the process after that?
Well, I think what the county will from my understanding, and I could be wrong, I've not been a part of a lot of these discussions, but, these meetings that are coming up in May is to really have them basically make their presentation to the county, for the county to engage them to do this service. And then, the county will select somebody that they want to work with on this. And I don't know their time frame of how long it would take for them to be able to go out and take an in-depth look at the healthcare needs, the healthcare services that are available in the county, what the population growths are, what are the trends. I don't know their time frame, but typically what would happen is they come back to the county and submit a report along with potentially their recommendations of what Franklin County needs for healthcare services in the county.
So once those meetings take place, then is there a formal, let's say an RFI, RFQ, or an RFP, which are all requests for information, requests for college qualifications, or requests for proposal? That has to be developed. Is these firms that we're going to sit down with, are they the ones that are supposed to develop that document?
I would, if their recommendation is, and again, I gauge this, if their recommendation is that the county needs to look at finding a company, an organization that would come in and take over the healthcare services of the county, then I would expect them to be able to assist the county in developing any of the RFP, RFQ that they would want to solicit bids for that.
So you believe that the county is the one that's got to prepare that document, whereas I am under the understanding or impression that the healthcare consultant that is selected to go forward will write an RFI or P or Q to go out to the public, to the industry for responses. That would be their job, the consultants, to write that RFI or RFP, not the county. The county would have input to it. I'm just trying to understand the process.
Sure.
So we're going to go over there, listen to all this, and then the county's going to select somebody. They're going to write, I would think, a contractual document according to the way the Florida statutes read and how we go about getting it. But that's not going to be a minute amount of money to develop.
No. I mean, this is going to be, these typically are fairly expensive to do this, and but again, it will all depend on, to your point, Mr. Berry, is that what do they write into that document when they do the engagement with this firm of what their roles and responsibilities are? So if the county wants them to develop the RFP, RFQ, then they would probably write that into the engagement document that would be between what firm they have and the county.
Well, then the last question I have is, would you be writing a proposal that would really be giving out what you think your approach and the best approach is, thereby tipping your hand as far as what the future would be with regards to the management of the hospital?
Well, part of that is in response to, I think, some follow-ups that we had after the meeting that we had received, through David and I think through Michael Marone, that the county would like to see what we would like to offer. And so we will, we'll be making that, we'll be responding to their request. Again,
coming in and making a proposal now to, rather than until after the healthcare consultants do their due diligence and do their thing.
Yeah, and again, I mean, I mean, I'm not, you know, I'm okay either way. I guess what I'm saying is because I agree, if we put ours out there, you know, somebody else can come in and say, oh, I can do it for $10 cheaper, you know, hire me. You know, or I'm gonna put out, you know, how the structure that we would work on it. Would it change, you know, whether the, you know, to wait till after the consultants are done? No. But David, I mean, you've had the conversations with Michael Marone, and wasn't it his request that we provide, you know, a more detailed proposal?
Yeah, what happened at the last county commission meeting? I think Commissioner Amison, somebody told them, you know, to prepare something for them. For
Prepare something
no, for the to prepare a proposal, you know, what they want to do for the hospital at the last county commission meeting. Now, we do have the healthcare consultants that are coming, you know, so before they make their presentation, I think, you know, of course, the healthcare consultants are coming in May. You know, the idea would be to find out what you want first, and then you make your presentation. But from the last county commission meeting, it was told to Alliant management that, to prepare a proposal, for what they would want to see for Weems. Now we can go back, I can make a call to Michael Marone. I can have Michael Kozar also. You can make a call to him to tell them when would they like them to make their proposal. Would they like them to make it after the healthcare consultants have finished, everything with the county, and then make their proposal? That may be the best way to do it. But I know at the last county commission meeting, it was said that, hey, you all, can you come back, bring us back something fairly quickly of what y'all want to propose to Weems? That was at the last county commission meeting they were at.
And the reason I asked the question, not to question anybody's integrity, but you don't want to get out of sequence on the process that has to be followed, because if you do, the loser of any type of RFP or IRFQ has a right to come back and say, no, that wasn't fair the way you did it.
Right.
Yeah.
Right.
Yeah, and so so Michael, I guess you can reach out, I'll reach out to Michael Marone as well. You can reach out to him and just get some clarity on that, because, in an ideal world, you'll want your healthcare consultants in place first. Get an idea of what's being planned for the county, and then you put it out there.
But as I said, we are very interested in doing a lease operating management agreement with the county for the hospital for the future.
Let me ask something. Will this be 5 years, 10 years? I don't want to pin you down with that, but wouldn't it be best to go with a lengthy? I know I would like a lengthy agreement right there. Maybe with a.
For example, in Shipley, the county in Shipley still owns the building and the land. But again, as I outlined earlier, Shipley is a for-profit entity, but Shipley has a 99-year lease on the building and land. Now, if you follow, it's a 10-year lease operating agreement. It automatically renews unless either party decides to change it for consecutive 10-year term.
Okay, I would think if 10 years is about the norm for this. I would think.
Yeah, it typically is.
I'm just asking what the norm is.
Sure. We had another hospital up in Illinois that the county came. We were managing the hospital, and the county came back and said, we want you to take over it. We ran it for a number of years, operate. And then there's volunteer ambulance companies out throughout the county. So we don't have responsibility for EMS up there, but we run clinics, we run the hospital, we do all those aspects. And again, we have in that agreement that limits the profitability that we can have after a certain point. That any profitability of that facility, and it can be structured in any way. In that scenario, that any excess profitability over a set amount gets shared back with the employee. In some places they share it back with the county government, but up there they wanted it to be shared back with the employees. So there is like a profit sharing plan there for employees once the hospital hits X amount of profitability.
Well, that'd be good. That sure would get some folks working hard, I would think. That would be that's unique.
Michael, is that an ESOP program? Employee stock ownership?
It's not really an ESOP. How it's structured is that money is then taken, and what they chose to do up there is to fund it into their retirement plan.
Okay.
So, it goes, that money then is put in as a match to the employee's retirement plan. So, it's not like, there's, checks passed out. It's funded in through their retirement plan.
Any other questions? I have one more question. I like the little beaver builds a bed right behind your left shoulder right there.
Thank you, Matt. My daughter wrote that book. Well, both of those books
Oh, really?
my daughter wrote those. So her husband is a professional furniture maker, and she's in marketing, and so she wrote a book. And it's on Amazon if you want to.
Signed copy, right?
It would just help, Dad and Granddad from some of the monthly stipends I have to give them.
All right. Well, thank you very much, Sheriff.
I appreciate it, Joe.
Thanks,
And
Michael.
again, I apologize I couldn't be there in person, but I was in Atlanta yesterday, and I have another board meeting in about an hour, and then I have to head to Grove Hill, so Alabama. So it was one of those days I couldn't swing it to get by there today.
This has been good. Okay. Next item is the foundation update, Bill.
All right. So everybody mark down May 18th on your calendars, because that's when the health fair is going to be, and I really want to get as many employees and their families as well as board members out to this event. We got to show our support for all these partners that have come and have decided to come. Now, we said how many partners? I think the update is 32 health partners are coming out. We've got some food trucks, live entertainment. We're going to do some, EMS is going to do some screenings, blood, heart, O2 and glucose. Fire truck's going to be there. There's kids' games, obstacle course, face painting. We got some baby goats that are going to be in a pen that kids can play with, pet. And we got a photo opportunity with a surfboard and the wave behind it like we did last year. We promoted the hell out of this as much as we can. We've got flyers out. We've got banners out in Appalachia and St. George Island. We did yard signs all over. You've probably seen them stuck in the grass all over town. And they are in East Point, and they are in St. George Island as well.
I got one next to mine. I got one close to my house.
And it's 10 to 1.
10 to 1. Apalachicola Times is running an ad 3 times coming up, and Oyster Radio is doing something in May for us too. So if we can get the word out, we need to get as much attendance here as we possibly can. It's going to be a fun day. It's not a long day, but I think we're going to have a lot of fun. And these vendors are very interested in offering their service. I think we also have a massage chair, so you can get a massage while you're hanging out in the sun. So there's a lot of good things happening there, and we definitely want to get,
I think, did Commissioner Ward put this on her website?
she did, Colleen
Great.
mentioned that,
was
yep, she
wonderful.
put it on, and she pushed that out through her,
Good.
people as well. And if anybody wants to volunteer, where we're really lacking is the second shift, which is 11 to 1:30, shift for people to do some stuff. We've got, some other, kids groups are coming to help the setup and all that, so, but the afternoon would be great if we can get some of our board out there.
Yeah.
That's kind of the health fair.
Yeah, that'll be good if we can get, if the board members can, want to come out and volunteer, but also on your social media pages, we all got, not we all, but many of us got social media pages. Make sure you share, that flyer, your next door app, make sure we share that as well. I'm really excited about this. Colleen has done a great job. Of course, Bill as well, but Colleen has done a great job with this, and our staff as well. But we're really excited about this opportunity. So if you want to just share, the flyer, begin to share it at your church meetings, community meetings, any kind of meetings. Just share the information.
All right, and then just the quick update for you on November 9th. Now, that's the Sapphire Gala that we're planning for the 65th anniversary of the hospital. That is going to be down at the Armory, Annex Armory. And that's a dress-up evening event that we're talking about. We're targeting between 150 to 160 guests. We're soliciting donation letters out in April. I think some are going out to some hospital vendors as well as local community businesses. We're looking, I guess, basic pricing at $100 per person for a ticket. That includes camera on the go, food. We've got live entertainment, a band called Scratch 2020, which plays here in Appalachian. They are excellent. They draw a big crowd. People love them. And then we'll also have, I think there's going to be a silent auction, things like that are going to go on during the evening.
When are tickets going, when are you going, tickets going on sale?
Yeah, I think what we want to do is pull the tickets out coming up. I guess it's June. I think it's what we're talking about. Go ahead. We're talking about doing it in June. There's also table options. If you get it in early, we got some discounts, and if you want to do a full table, which is 8, there's some discounts for full tables as well. What we're also looking for is higher level sponsors. If anybody knows anyone that wants to, in town, that wants to just, sponsor something or be put on our sponsor list and that way be promoted as a sponsor of the event, we've got some options there. And also, if the board knows anyone that has, wants to donate any kind of items for the silent auction, we really want to keep it high end. We don't want to have auctions for T-shirts, but if you have something that's over $50 in value that we can put on the silent auction, for instance, Richard Bickle is going to pull out. You can do that. Bickle's going to pull out one of his photographs framed, and that's going to be on the on there as a silent auction item. But we're trying to pick up more of that kind of stuff for the auction and miscellaneous. We're going to do some ticket promotion with regard to the July 3rd event. July 3rd, as you know, is Independence Day event that's here. They get a big crowd down at the waterfront. We're looking at putting up, Foundation is looking up putting up a tent there. I think we may have we're working on trying to get this lemonade vendor to come. We're looking at doing some cups with the Weems hospital logos and things on them, supporting, or, for the gala. Maybe a QR code or something like that they can pick up off at a cup, and promoting the gala at that event. Maybe even July 3rd. And so we're looking at doing an announcement there where there's a big crowd of people, and that could certainly promote our gala event. And we'll be selling tickets there for the gala at that table. Maybe we'll even do a raffle for a free prize, maybe 2 tickets to the gala. So we're trying a couple different ways to get out there. Anybody wants to put their, again, I think you said social media. it would really help the foundation if you went on to the foundation site, Facebook site, and signed up on the foundation, because then we get at least 100 people on there. We can interact with that group a lot better. I think we're close to that number, but to push us over the top would be over 100 would be helpful.
All right, so what he's saying about that is that, go to the Weems Foundation Board Facebook page and like it.
Yeah.
Once you like it, then we get more likes, get 100, and we good to go.
Yeah, you follow it.
Follow it.
Like and follow.
I'll do that for you.
That's all I got.
Okay. All right, do we have any other business? Any board members have any other business?
Just want to ask again about the bylaws.
Oh,
Yeah, but,
have we got them yet?
well, they're with Attorney Schuler.
Attorney
Yeah,
Schuler?
and so it's out of our hands. I asked him about it, a while ago, but it's in his hands now. So
Oh,
he
yeah,
said,
he's got them, that's right.
yeah,
We
he
had
says
got
that,
'em,
yeah, he says it's out of your hands, it's in my hands, so.
Okay, anything else? Okay, this part of the meeting is adjourned, and we can either go in executive session